So we'll just move right into things. So I want to again welcome everybody, panel members, the public audience and the media. And I just want to say, how much I appreciate that we've had members of the public here, people interested, because you are the ones that help us do our job. If you're not here and you're not giving us that feedback and being actively engaged, we can't be effective. So thank you so much. I also want to note that MLA Craig Coulahan from Calgary-Klein is attending on behalf of MLA Nicole Goring just for the morning, and she'll be here this afternoon. Okay. And just a reminder, as always, that you can provide input, and there are laptops just outside the room, and it will always be to the cipanel.submissions@gov.ab.ca. The meeting is being audio live streamed to the panel website, and part of today's meeting will involve some simultaneous small group discussions. So a reminder to please always speak into the microphone so that we can preserve the quality of the audio recording. And again, just a reminder, our meeting last, whenever it was, that we held at Mamawi Ataskawin, which was in Calgary. And the facilitators worked. We spent a good long day working with the panel to obtain consensus on the solution statements identified on yellow cards, and these statements were also included in the panel meeting summary and publicly posted. So again, I want to thank everybody for all of that hard work that we engaged in last meeting. The Secretariat has consolidated the consensus-based solution statements on all of these yellow cards to represent the information coming out of the March 30th meeting discussions. And you would have received this document yesterday, the summary of it, which will include draft principles that we can use to guide recommendations, as well as 3 key action areas. And I'm trusting that this will be helpful to all of us today as we further our discussions as we make the effort to reach consensus. And I should have mentioned at the outset that MLA Greg Clark is unfortunately also not able to be with us today. He tried very hard, but his health comes first. So we're working hard to fulfill our mandate from the first phases of our terms of reference. And I also want to acknowledge the support of the Secretariat and the Government of Alberta officials who have been working with the panel every step of the way and supporting our deliberations without interference. They're here today, and we may need them to provide clarification at any point, and I will encourage anybody to ask should you need clarification. So we'll be referring to the principles developed by the panel. That will be the basis of the deliberations on the development of the final recommendations, as well as implementation of an improved and strengthened child death review process for Albertans. The principles include a focus on addressing preventable deaths, increased accountability and transparency with a focus on continuous improvement, provision of meaningful data, actions that are concrete and measurable, and increased information sharing while respecting the privacy of those involved. Key action areas supported by the members include the establishment of the Office of the Child and Youth Advocate as the primary authority for the child death review process, ensuring meaningful engagement and inclusion of families, communities, and stakeholders in the process. And the third area, which may be the one that requires more discussion and clarification, is the issue of internal accountability mechanisms with direct linkages with the Office of the Child and Youth Advocate reviews. So I'd now like to invite our facilitator, Damien Travers, who's back with us today, to lead us through the refinement and finalization of the recommendations for improving the child death review process. Unless there's some questions. Rick, you had something? Oh, okay, I thought maybe you had a question before we started. So, take it away, Damien.
Alrighty, so first off, thanks for having me back. It's good to be back with you. I know my colleagues, Lisa and Kristen, were working with you at the last session and helped you form the 9 solution statements on the yellow cards that has ultimately funneled into this potential recommendations for the panel consideration document. Just a couple things in terms of our process today. Our trajectory, of course, is to help close out phase 1 of this overall review. And in doing so, what we're really focusing on is reviewing and discussing the consolidated statements, making sure that we have time to refine our recommendations, and then ultimately we want to review and finalize any recommendations to the point that we can get them here today. Once we can do that, we can discuss what next steps and have a debrief on what the phase 1 process has looked like and what the experience has been like for you. Is there any questions about that agenda, about that trajectory for today? Alrighty. So right now we are scheduled to go to 10:30 and then we'll take a break and then we'll go 10:45 to noon and then there'll be another break. And of course we're back together this evening. So the first thing I want to make sure is everyone's had a chance to review the document, the consolidated document. They're very familiar with it. That you've had the chance to really go through it very clearly. So I'm just going to give you a quick minute if you want to take one last review before we kind of get into a focus discussion. And a focus discussion, again, is just me taking you through a series of questions to help review what this document looks like. So let's give you one more minute to review that. The consolidated statements document. No problem. Good question. Alrighty. So the document that you are reviewing is meant to be a synthesis, a distillation of all the material that you came up with and had a consensus around on the 30th. As you review that, the first question that I have for you in reviewing, and we'll just do this as a popcorn style, so we can go at random table to table. But as you read this, what are your initial reactions? What's standing out to you as you go through the document? And please remember to speak into the mic. Jason? Cameron?
I think what stands out to me is that these seem to address a lot of the concerns that we've heard over the last several meetings, sort of simplifying the process, having a clear accountability and transparency mechanism through the OCYA, including families and cultural practices. So, it seems to me that this is a pretty accurate summary of the things that we've heard and the solutions that the committee has proposed over the last couple meetings.
Okay, thank you. Graham, and then Jason, you want to go up next? Okay.
One thing that stands out to me, well, that's loud. One thing that stands out to me is really looking at actually having tangible measurables from the review process. I think it's important for us to actually try to get something out of the review process and for it to actually drive change instead of it sometimes being repetitive. And so I'm really looking forward to how, and while it's for some may seem like a no-brainer, for us to really try to implement smart concepts into driving change within the child intervention process.
Jason? There's Mike over here.
How's that? Thank you. Are you looking for details, or are you going to go drill down that a little bit, or you're looking more for like a high-level overview of what we think of the document? I don't quite understand your question.
We're gonna drill down. So we're gonna start high level, and then we're going to drill down as much as we can here today.
Well, first, from a high level, while I agree with much of this document, I do think it's important to point out that these would be what I would describe as goals and not recommendations. So I think we're going to have a conversation about what recommendations have to go with those goals so that we can accomplish, or so that the department could accomplish the goals that have been put out there. I also have to point out that the whole reason this panel was formed was for, and while I know that we don't want to go through one case, and that's fine, I'll respect that, Madam Chair, there's not a recommendation or a goal on this list that would have anything to do with Serenity. In fact, she would not apply under what we have presented there, and that's going to be an issue, and that's an issue we should probably discuss.
Thank you. Maria?
The whole thing looks holistic to me.
Rick?
I think what's actually there is a representation, fair representation. What concerns me is not there. What's not there I'm looking at the particularly number 3, the accountability piece, and it says ensure accountability for the child prevention program. Nowhere does it talk about accountability for the child prevention managers or people or any, and that's, and to me, we're mirroring the exact problem that got us here, is that kids are dying and no one's responsible. And this will have kids dying and when kids die, no one will be responsible because it only has accountability for the program. And I think until we get past that, we will be continuing the problems and not solving them.
Can I just clarify
Debbie?
what you mean, Rick, when you say no one responsible? Are you talking like what would that look like, that responsibility to you?
Sure what it would look like, but Mandy, it's, the program is responsible. There's not, see, at some point, John or Fred or Mary or Jane or some human being has to be responsible. Whether it's the statutory director or whether it's somebody has to be accountable for what goes on. And if it's nobody's fault, then nobody's accountable. And essentially, someone that has to be responsible for things going right, and they have to be responsible when things go wrong. And this talks about the program being held accountable. Well, that seems to me that's exactly the problem we're trying to solve, is that no one's responsible, only the program. And this, in my estimation, is a continuation of the problem we're trying to solve rather than solving the problem.
Okay. David?
Well, I think that's a fundamental issue for all of us. And what I've come to after both years in medical practice and now looking very intensely, both in 2014, the panel that was chaired by Manmeet Bhullar, and this panel, is that everybody is responsible. The health system, the school system, the counselors, the caseworkers. The desire to focus on blame is not helpful in the bigger picture, because we have to look at the way systems are communicating or failing to communicate. A child that, for example, Serenity, 4 years old, has seen so many individuals, so many organizations, and so many different approaches to try to help her, including the police, that I think it's a false goal to try and identify an individual. Yes, within an internal investigation, the department would identify something that was grossly inadequate, negligent. And that's part of what every system has to look at and every courtroom has to look at. I don't think that's our role here. I think our role is to try to look at the way the system is working and ensure that we have the appropriate checks and balances and quality control and accountability. I think that is our role, in fact.
Just 1 second, Peter, you're up next. Okay, Peter?
Well, I think that the prior comments from Jason, Rick, and David are important. Accountability exists at different levels. And so systemically, the statutory director holds an accountability for the provision of services to children that would protect children. And so that's sort of where a legislated accountability is going to sit. And then you have delivery accountability, which is how did Office X, Team Y accomplish the legislated mandate to protect the child. Then you're going to have the accountability of the caregiver, who may or may not be the individual responsible for the death of the child. So at some point you also get in then to criminal accountability of who killed the child. The systemic accountability is, Did the social worker do what was reasonably anticipated that a social worker could do with the information available at the time to protect the child, knowing that you cannot with accuracy predict human behavior, and so you can't predict that that parent is going to kill that child. You can't do it. It's just statistically not a possibility to accomplish that level of predictability. But then there's the accountability at a criminal level of who killed the child. The danger of the accountability conversation is, and we're seeing it in the United States, and that is the criminal accountability for social workers not being able to predict and thus not having saved the life of the child. There's social workers presently in trial in 3 jurisdictions in the United States based on that issue. And so when we talk about accountability, we have to be clear about which accountability are we talking about, which level of accountability, and who do we perceive as to be held responsible within that accountability. The one other piece I want to say is if we handle accountability badly and we focus on blame at an individual level, and there may be occasions where that's going to be appropriate, but generally if we focus on blame at an individual level, we then fail to accomplish one of the fundamental issues of the child protection system, which is family preservation. Because there is a substantive amount of research that will say, increase the level of shame or blame or guilt within the direct workforce, and you increase apprehensions. Direct correlation. The United Kingdom went through it. They've yet to get that number back down. So we have to be sensitive to how we do accountability so as to not put more children at risk of unnecessary apprehension so that the system protects itself. Because I think that's an undesirable outcome of accountability. I would equally, by the way, agree with Rick that we need to have a conversation about what's not in here. Because there are things that are not in here that I think are important, and as we drill down, I hope you'll bear that in mind. So thank you.
Third question. I'll go to Jason, and then I'm going to transition.
Well, I have a question at the end of it, but one. Is this on? Sorry. I have a question at the end of this, but one comment in respect to my colleague, Dr. Swan's comments. Yes, if we're talking about trying to find blame during the process, that's not what I believe Mr. McIver was talking about, nor what I'm talking about. The fact is, with the limited amount of information we were able to receive from the department during this panel, we do know the fact is that 0 investigations have been completed by the department. Nobody is accountable for this process anytime during it, and there's no way to hold them accountable. So whether or not you're talking about the blame of the person that was involved in the child is a separate conversation from who's accountable to make sure that this gets done and that we're not back here every 3 years. And that is not spelt out in this document. Hopefully, if we can drill down, we'll be able to make sure that we're not going to be here over and over. I mean, again, I go back to the fact that the child that has caused us to be here this time would not even be investigated underneath this sheet, as far as I can tell. My second thing is that I've asked this question from the beginning of the process, and it keeps being delayed in being answered. But this is a ministerial panel that has been set up different than a committee, and what will be the plan at the end of this for a dissenting opinion or a minority report?
Do you, so before we move on, is there a response to the question?
I mean, we can absolutely clarify that, but my understanding of the process as we're working with a consensus base, that there would certainly be room for, at the end of the day, to leave an item where we were not able to reach consensus, or if there was some, outliers there that that would be noted in our final report. That's my understanding.
Okay.
The Secretariat will summarize it on our behalf, but as it's going to be the panel that will ultimately, say yes or no to what the report looks like.
Okay. Thank you very much, Madam Chair. Heather?
So I just have some thoughts around specifically Serenity. Can everybody hear me? Okay. So the reason that Serenity was investigated under the OCYA, the OCYA has done a report. I think what we're trying to do at this point, and we can talk about the OC ME piece differently, but today, I think there's a recognition that things can be done differently and things can be improved. And my understanding under the OCYA as of today is that they can investigate up to 2 years after a child is receiving services. So Serenity would have qualified for that. But if we're saying that that wasn't sufficient and that we would like more accountability, which I believe is what we're saying, and we want to make sure that the recommendations actually make sense and that we're not doing duplication and that we're looking at strengthening that, I would like to see us have a conversation around how we strengthen the process. And so, I mean, again, last time when we were in Calgary, I'd mentioned like the Auditor General and how that capacity of being able to go in and audit and make recommendations that the government is then accountable for, that then has to go in front of a legislative committee for accountability measures. I don't see why we couldn't strengthen that with the OCYA, and it reports back. And there is that public accountability that says this stuff needs to be fixed. I mean, I don't want to minimize Serenity's death. I absolutely do not. I, however, would really like to do some solution-focused conversations around how we can make sure this doesn't happen, or at least minimize things like this happening again. And I think we need to, I don't know. That's just where I'm at with it.
Okay.
Sorry.
So I'm going to use this as a transition point. I'm hearing a couple things. One, there seems to be an appetite to look really at that third action area that is on the sheet around accountability. And then also, I think Heather was speaking to the first one as well. There has been questions about that, where you need to get through in order to get to those pieces so that we can identify those clearly. Jason, did you have one final point before I move on?
Just that, yeah, Ms. Sweet is correct. The advocate was able to use their ability to investigate something that was not being investigated by anybody else and point out that there had been no investigation, and in fact that nothing had been done in regards to that situation. That's the problem, is they don't have the authority. So that's what, to your point, we're going to have to drill down, because writing a report is not getting the bureaucrats to do the right thing. That's the facts.
Okay. So I want to bring it back to this page because ultimately the consolidated statements is our jumping off point to drill down from these things. And we can start drilling down, but I want to make sure, at least to start with, that these things have been reflective of our conversation. So that's a question I do have for you, is what you see in front of you in terms of the draft consolidated recommendations or consolidated statements, are they reflective of the solution statements and the consensus points that you had on March 30th? So are they reflective of that conversation? Making sure we don't lose anything along the way. Rick?
It's largely reflective, but it still is short in the accountability area. And to be clear, after I heard Dr. Swan's remarks, the last thing I want is social workers being afraid to go to work. Actually, I would prefer that we put accountability into place, that they could stand up straight, put their shoulders back, be very proud of what they do, and say, you can't predict everything, but in our system, when something goes wrong, by golly, we got a way to fix it. Mm-hmm. And I don't see that here.
Okay. Other thoughts, opinions? Is this reflective of the conversation that we had on the 30th? Anyone think it's not reflective of the conversation on the 30th? We've heard the accountability piece. Is there anything that's not reflective of that conversation? So then the question I would have, because it's come up, and it was asked, are we going to ask this question? Of course we're going to ask this question, is there anything missing from this document? So is there something that's missing from this document? Peter.
I think there are a couple of very important process issues missing from the document. If we're going to establish the OCYA as the primary authority, then by definition that means we are discontinuing the role of other agencies in this process, because we did say in Calgary multiple times duplication was a problem, but we haven't eliminated the removal of the duplication here. So, for example, we haven't dealt with the CQA, the Domestic Violence Panel, the Fatality Review Board. We haven't addressed that here. We have not, in the accountability section, reflected the discussion that we had around the obligations of the statutory director, which we had in Calgary. We do not have, and I know this was really important to Dr. Swan, we do not have the knowledge to practice methodology that we talked about in Calgary.
Can you clarify that last point?
Yeah, Dr. Swan, I think, found and led a very important conversation about there's no sense doing the review if it's not getting translated into practice. And so that, I think, is not as representative. We are also missing the specific supports related to staff that we talked about. And in terms of the enhanced responsibility for the OCYA, we haven't here talked about the relationship between the OCYA and the OCME, which we spoke about in Calgary. So those are the knots there that come up for me.
Okay. Bruce?
Just building on Peter's comments, and those are several ones that I identified too. The other one would be clarity in reporting. So being really clear about the differences between preventable deaths and non-preventable deaths or accidental deaths. And so public reporting needs to be clear about the things that we are responsible and accountable for and the things that were accidents. And right now, everything is being presented in a way that looks like a bit of a bigger mess than it is. So we need to be real clear about the terms of reference, about what we're actually addressing with these cases. Mm-hmm. And again, just to follow up on the knowledge to practice, that we really need to make sure that the circle is closed and that the information is coming through. As Peter talked about in previous sessions, this is never going to get down to zero. It's more a question of getting the number of child fatalities down as low as possible. And when it does occur, that there's a learning process to reduce that occurring again.
Okay, thank you. Rick?
Here's what I think. I've been fairly frustrated with this process, but I'm working real hard to be positive and constructive on the thing. The last meeting we had in Calgary was very good because we finally dealt with the concerns that the committee members had. We categorized them all and we put them all under categories. And for you, if you want, I've got photographs of all the places where we put them under which categories, which I'd be happy to give back to you. And the reason I would be happy to give them back to you is when we include all these things that everybody in the committee put in and had them categorized under the general areas where we need improvement or we can make things, I think everybody was happy. Mm-hmm. Now, someone has edited and sure put a lot of work into it, and I apologize to him for what I'm next going to say, and basically clip a good part of what the committee all agreed on out of it. And we could put it back into where we're all happy and move forward. I really think I left that meeting thinking that we had a really good chance of making things better. And now I think we've moved back to before that meeting, and now I'm frustrated again. And I'm guessing I'm probably not the only one on the committee that feels that way. So if we actually put back in the things that committee members, not any particular committee member, but all of us are concerned about, I thought we all got along really well and all felt like we were pulling together in the same direction. Mm-hmm. And now we're going into some direction that somebody set that I don't know.
Mm-hmm. Okay, thank you. Or Jason?
Yeah, I think Rick's got a good point. I left Calgary feeling for the first time positive on this panel that we were getting somewhere. And as I look at this document, I feel like, why did we even meet in Calgary and go through all that? Because so much of it's been clipped out. And to be quite frank, there's so much of it, it's going to take time to be able to get it all there because we don't have a proper record of these meetings.
Maria?
Okay, maybe I'm just missing something here, but Rick, I don't know what you think is missing. Can you tell me specifically what's missing?
I would have to go through every piece of paper, but the last example that Bruce gave, it's on one of the pieces of paper that was on the wall. And Bruce, if you can remind me of that, but that was exactly one of those things that was on a piece of paper that was under one of these things that was clipped out, and Bruce just asked for it to be put back in. And Maria, I could be happy to share the pictures I have you of all the things, and everything that's on here that's not on this thing today would be included in what I say, and there's a lot.
Okay. Cameron?
Yeah, I know we're kind of getting bogged down here a bit, and I just want to clarify the process, because from what I understand, what we did in Calgary is we took a lot of ideas and kind of consolidated those into themes and problem statements, and that's what's reflected here on this consolidated statements is those problem statements that kind of contain amongst them all the various ideas. Pardon me? Oh, well, no, I don't think they were cherry-picked. I think these are trying to distill those very detailed ideas. And so we're here to discuss if those reflect those detailed ideas. It's not that those are gone. Those are still there. These are just sort of a summary of those. Am I correct in the process that we're here for today?
I think in terms of what I heard, in terms of how we got, what we went through on the 30th and what we've tried to do in terms of consolidating, I'd say that was the general flow. Now, the question is, do you feel that way? And that's the $64,000 question.
So I'm hearing from Jason and Rick that they feel something's missing. So we're here to ask them please specifically tell us what's missing.
I'll be happy to repeat myself. Everything that's on these photographs of the things that we put on the wall last meeting that isn't on here, we're missing. And there's quite a bit.
Okay, Bruce?
So we went with the process of moving from 300 down to about 8 or 9, I think, last week. And I think there was consensus about getting from 300 to 8. I think part of the discussion today is the fact that there's less consensus about getting from the 8 to the 3. So perhaps we can go back and kind of revisit that transition to make sure that everything from the 8 comments that we were in agreement about, that everybody had a statement about, are actually being reflected in here. So could we go back to some of that supporting document?
We could work out something for sure.
Yeah.
Other thoughts, opinions? Heather?
Yeah, so I'm just wondering, maybe if we could, instead of looking at the whole document in the sense of 1, 2, 3, can we just focus on 1 and start talking about the OCYA and what we feel is missing and what we want to see, if we see that role as being the appropriate role, and maybe just focus on the key action area number 1, and we can move through what we think is missing, what still needs to be added, and let's, instead of trying to take one big chunk and make it in and try to fix it all right now, let's just start with number 1. And can we move through that and maybe talk about what is working well, what in here we like, and then if there's things that are missing, can we add the things that are missing and maybe just focus on number 1 first, and then move to number 2 and move to number 3, and then if there's still some things that we feel we've missed, we can add that at the end, so that we're actually, instead of doing like a big picture, because we could talk around this for a long time.
Go back to Bruce.
I think there's merit in looking at it that way. I think the other option I think that would be helpful for me is making sure that the 8 points are included somewhere in the 3 points. 10? Yeah. So if we could, kind of go back and revisit that, because that's the last point where there was agreement, where we had consensus on that.
So what I'm hearing based on that is, let's go through these one by one, identify what we like, what we don't like, what we want to see change, what we think would hold the need of the recommendation, and then make sure that all 10 of our points from last meeting are captured by the end of the day.
Are you talking go through the 3 that are on the table, or to go through the 8 or 10 or whatever to Bruce's point? Because I'm with Bruce.
So what I heard Heather say was go through what we currently have, make refinements, make adjustments, get what we need to get out. And then what I'm hearing Bruce say is make sure that nothing gets lost from those 9. So we can go through them one by one, then we can come back through the 9 and make sure that we're capturing all our key points.
Does everybody have the 9 in front of them? Okay,
We're
so
getting
why
it
don't
right
we,
now, yeah.
Okay.
Yeah, I just talked to the secretariat, and she's going to make sure that we've got a copy of all of this so that we can, better reference.
So what do you want to do?
Maybe take a short break right now and get the papers that we need before
Okay.
we continue. Would that work?
That absolutely works. How long would you like to take, Madam Chair?
No more than 10 minutes?
10 minutes?
Yep.
Sounds good. Alrighty, if we can all return back to our tables, we'll get started here once again. So, are we ready? Sure.
Yes.
We're ready. Alrighty. So there's 2 ways we can go forward. I'm going to pose it out to you because ultimately this is your job to make the recommendations. We have the options as being we can take the 3 key action areas and we can cross-reference back to what the 9 areas were, the 9 solution statements from the 30th. Or we can scrap the 3 key action areas and we can build up from the 9 solution statements that were developed on the 30th. Either way is fine by me. Ultimately, this is your process, so I want this to be whatever you're most comfortable with. So I'm posing it out to you. Which way would you like to proceed? We can scrap the 3 and go with the and start building up from the 9, or we can cross-reference between the 3 and the 9 and make sure everything's captured. Bruce?
Can we just go in reverse and go from the 9 to the 3? So go through each one of the 9 points and say where is it located or embedded in point 1, 2, or 3.
So do some cross-referencing?
Yeah, that way rather than the opposite.
Yep. Other thoughts, cross-reference versus building from the ground up? Debbie?
I think this table is in agreement with Bruce.
Okay. Anybody have objections to what Bruce has said? Alrighty, so we'll cross-reference between the 9 and the 3. So I'll need you to hold 2 sheets of paper in front of you. One should say solution statements to MPCI homework facilitated working session March 30th, and the other one should be the consolidated recommendation page. So if we're going to cross-reference, I'll start with the accountability. So we have accountability, death review shall provide effective recommendations that address preventable death, create accountability, support continuous improvement, and provide categorized data to support improvement, accountability, responsibility for service delivery to vulnerable children. Do we see this captured in our 3? Cameron?
Yeah, I think that's covered on the first page, but not as a numbered item necessarily. It's in the, I guess, the second paragraph with the there's 6 bullet points there.
Okay, so under the principles.
Yeah, the principles.
That fit in.
Says it'll be applied and implemented to all of the recommendations.
Okay, other thoughts? Do we see this in the document, Bruce?
Yeah, so it shifts from a recommendation to being a principle that guides recommendations. So that's the difference, and I'm fine with that, but we need to have some agreement about shifting to a principle. It becomes a guiding principle rather than a specific.
Yeah. So as Bruce was just saying, the feeling is that the accountability piece, that for A piece has become an overall guiding principle that goes across all recommendations. And the question is, are we okay with that? Heather?
Sorry, maybe I haven't had enough coffee today. Are we trying to get to three key action areas? Are we trying to get to the 3? Like, what is our outcome for the day, I guess is what I'm asking, so that I can understand I obviously just don't understand what I'm doing. Maybe.
So I just asked the question if we wanted to throw it out or if we wanted to cross-reference. We came back and cross-referenced. But are we having a change of mind on that? Graham?
Originally, I was going to mention in relation to some cross-referencing here, I see some frustration that's coming from Rick, and so just because we mentioned that we're going to cross-reference, it seemed okay, but I want to probe further just to hear what he might, if he wants us to go back to the 9 again, or does he want us to continue cross-referencing and looking to see if the 9s are captured in these categories, and where we're missing anything? Like, I'd be happy to hear from him in relation to that.
Rick?
I'm just wanting to actually find a way to get back to where we were all on one page, which we had the 9 things where we can move together forward constructively with some confidence that the most important things that all members of the committee put forward are included. And it seems like we've already captured that in the document that goes from A to I. I guess if we try to shoehorn it into the 3, we'll spend 2 hours accomplishing nothing except moving stuff around on a piece of paper.
Mm-hmm.
That's what I think, but I could be wrong.
Jason?
Can I just
Graham,
go
you
back
have a
to,
rebuttal?
I just want to rebuttal to Rick, because the one thing that I'm seeing a little bit in relation to here is that of the 9, there are certain things that cross over to each other. And you know, when I speak specifically, and this is why I got really excited in relation to the comments about SMART goals here, is because SMART holds accountability if there's systemic problems within the system. It also ties into timelines in certain facets, because now we hold firmer timelines into when we move forward to systemic issues and when we set firm goals. Because we have achievables and we have specifics and measurables, it also ties into transparency as well. So this is why I enjoy a little bit of the cross-referencing, only because I think that there are 9 items captured here, that some of them could be tied in together, or if we want to try to zero into specifics, we find them here. I'm happy to work with the committee and go whichever direction we want to go here. This is why I'm liking both these formats and us cross-referencing, but I'm happy to hear from Jason and from Rick, because I know that they're feeling some frustration here in relation to what they want to see, because this is kind of how I'm perceiving it, but I could see that they're perceiving it a different way.
Well, I don't think it's just Rick and I are feeling frustration, but that aside, I feel that we left Calgary with 9 fairly high-level categories. I would almost describe them as goals that we would like to see the system be able to do. And I think we should focus on those and getting recommendations associated with those high-level goals that we can put into the final report that are clear on how you can make that done. And while I recognize that some people feel the second document is doing it, it's not working for me. In fact, I'm getting more confused by the minute. So I'm with Rick. Let's go back to the original document and let's come up with some recommendations on how to do what everybody agreed was what we wanted to accomplish. I was actually shocked when we left Calgary that everybody agreed on it. So I don't know why we'd want to go back from where everybody agreed.
Debbie?
Okay, and I know it's not just Rick and Jason that are kind of feeling a bit of confusion here. And I will echo what Heather said about, are we trying to specifically narrow this down to 3 goals? Not necessarily. So I think maybe it makes sense for us to go back to this, the first of the 9, and then let's work towards, and if it comes down to 3, so be it. If it comes down to 2, so be it. But let's maybe start. Would that work for everybody?
Yeah.
Okay, let's go from there.
If I may comment in relation to that, I'm actually really happy to work with the 9. I just want to make sure that one thing that's not lost is that we recognize that some of the 9 statements can start tying together to find some solid improvements. And I want to make sure, in my mind anyways, that's kind of a focus that I have, is that we can tie some of these things together, because you can solve 2 problems with the same method. And that we still keep that as a focus while we're addressing the 9 here as well.
Okay. Peter?
So if we work with the 9 and we come out with recommendations that have crossover, I don't think that's a problem, because ultimately the minister's got to be able to translate this into legislative or policy action. And so the drafters of that are going to have to take the 9 and say, what pieces of legislation are we going to either have to amend or introduce? And so the clearer we are, I think, in the 9 points, the easier it is for the drafters of the legislation to then take it forward and be able to bring it to the House in a way that the political arm of this whole exercise says this makes sense, we can see how it would work, and it is accomplishing our 9 objectives. I think thus I'm not so worried about crossovers in some of the points.
Thank you. David?
Yes. Well, I hesitate to raise yet another element of this, and our discussion here has been helpful for me to, I'm conscious that my past life was around the whole area of prevention. One of the key elements of what we're doing here is trying to prevent deaths in care, prevent children from getting into care, and we're focused on the death review process, to be sure. And in the next phase, we'll be focusing on the broader issues relating to children having to become involved in care and perhaps dying in care. But this death review process is too narrow. Thank you for raising that, Jason. Why is the death review not looking at the role of the police, the role of the social services system generally, the role of the education system, the role of the healthcare system? If we're really interested in the multiple factors that are contributing to a death, why are we solely focusing on child services? When all of these have had roles, including the guardian or the adoptive family, and the community around that child, under law, if you see evidence of abuse as a citizen, you are required to report it. You are legally liable if you fail to report evidence of a child being abused. That's one of Jason's issues.
Patty?
Why don't we broaden the scope of this death review? The Office of the Child and Youth Advocate focuses solely on the Children's Services and the DFNA. There are other systems critically involved in whether this child does well or does not do well. And I don't see enough discussion here that the mandate needs to be broadened if we're serious about preventing deaths.
All righty. Patty?
So I wasn't here on the 30th, and I'm kind of playing catch up, but this is the last day that we have to do this. And right now, these 9 statements are great, but they are essentially just be better statements. And if we don't get down to drilling down on every one of these and get some really clear, specific recommendations, we won't have done any smart recommendations. We won't have achieved anything. So I'm kind of hoping we can now go point by point and get something very specific for the Secretary to work with so that we make meaningful change. This is the last day we have on this phase, and I feel like we're just spinning our wheels. So if we could drill down on some of these and get some specifics in small groups or whatever that's going to look like, I'm ready to work. Just saying.
Debbie?
And I just wanted to comment on what David brought up. I mean, I think that's very valid, but I do see a role for that in our second phase. If we look at item B under the OCYA, it talks about if we strengthen the OCYA's role, we would give them more resources, more authority, wider scope of practice. That could then encompass all of those pieces that you've talked about that, then they can be brought in. But I don't think, trying to do that right now at this point will really help us in getting to the goal that we have. But definitely, that should be part of our next phase.
Okay. So what I'm hearing is, we are concerned about scope, but we're here. It's our final day. We've got it down to 9 areas of focus, and we really want to get those recommendations out. We're ready to work. We want to go back to the 9 and go from there.
Yeah.
Is that fair?
Yeah.
Okay. So what we're going to do in terms of process, we'll start with the 9. and we'll have a conversation around where we see synergy between those 9. And when I say synergy, the question that really comes to mind is, when you look at these 9, are there pairings where they're very similar in nature, or they can work very closely together in order to strengthen or streamline the system? Once we look at that, I would break it out amongst small breakout groups, and then have you taking those synergistic ideas and start to hammer out the detailed recommendation that I think we're all thirsty for. Once we have kind of that detailed recommendation drafted, we would have it presented back, and we would review it as a full group. Does that make sense to everybody? Jason?
I think we're getting close, and I agree. I just want to get to work. My one suggestion would be that possibly out of these 9, that we need to focus on the Office of Child and Youth Advocate, because if that's going to be the main, core of the recommendation is to go there, then I think everything else spins off of that. So maybe we should start with B, and then the other stuff I suspect may be easier to get in once we know the structure that we're going to go. I will leave that. And second, I still hear you saying that we need to shrink it, and I'm not convinced that it needs to go much below 9. But I'm happy to go through the process to figure that out. But I hope that we're not going into it, trying to say we have to get to 4 or 5. Let's get to the right recommendations. And
There's
if it's
no
9, who
no
cares?
predetermined nature, and the reason we would do the synergy is because it's system, and we want to make sure that if there's things that are closely related, we might come up with recommendations that are overlap, but as Peter said, that's not a bad thing. Alrighty? So if we look at the 9 that we have accountability as I'm just using this to hold the entirety of that column. We have the role of the OCYA. We have duplication. We have timeliness. And we have transparency. We have family supports. Privacy. Cultural. And we have family inclusion. So again, we're just looking for synergy. Are there synergies that exist where something might be closely related to another topic that it might work together to help strengthen and streamline the system very closely? Out of these, do you see any 2 that might work that very closely together? We might want to group them as we go through our exercise. Cameron?
I think that the role of the OCYA can be involved with timeliness, because if we are streamlining the number of review processes, if the OCYA is sort of the go-to body for all of these investigations, then it's clear that when we're looking for an investigation and a report, we look to the OCYA. That's the entity, and I hesitate. I don't want to get into specific timelines because I don't think that's what we're here for. I know we can all agree that timeliness is a factor, and if the OCYA is the responsible body, then we can look to them for a timely response.
So we can see a close relationship between making things timely and the role of the OCYA. Jason, did you see synergy here?
Well, probably family supports, family inclusion would have lots of similarities, possibly culture even within those 3 groups. Accountability and transparency, I think, would have some similarities. The OCYA, so B, and duplication may have some similarities, as well as probably timeliness.
So you spouted off a lot of them there. I'm just trying to track you. So I lost you at accountability, transparency.
Yeah, if Answer was here, they would have caught it. Just kidding. So I said family inclusion, family supports, culture, transparency and accountability.
Yep.
OCYA, duplication and timeliness.
Okay. Other thoughts? Where are we seeing synergies? Peter?
I guess I'm going to be mildly obstructionist here. This is designed to say, what's the death review process? And we're saying that the OCYA is the agency that will be responsible for the death review process as the agency of primacy. And we're talking about the elimination of duplication of that area. And we're really saying that the OCYA should be doing all of the following 9 things as part of its death review process. To me, the recommendation is the Office of the Child and Youth Advocate, with a broader mandate, will act as the agency of accountability, supporting continuous improvement and informing the system, as well as acting as a vehicle of transparency. And it will take into account timeliness, transparency, family support, privacy, cultural and family inclusion. But it seems to me that if we're talking about a death review process, and that's our outcome, it's who's doing it and with what principles. And I think we haven't come to the full consensus yet on the who's doing it, and then what are the principles.
Okay. Okay, so we'll come back to that. We'll make sure we get to the recommendation stage. I want to find out if we see any more synergies before we get into that recommendation forming piece. And certainly, Peter, I think I'm going to be giving whatever group you end up in the role of the OCYA after that statement. Privacy, does this have a synergy with anything?
I think privacy overrides everything.
So it's got a larger piece. And then I heard someone over here.
Transparency, and because it really is about striking the right balance between privacy, transparency, and accountability. And don't mean to argue with the previous speaker, Maria, but I think we as a committee all agreed that privacy, it doesn't trump everything. I think we agreed that it's going to be very hard to do, and we've all, I think, agreed that it's going to be very hard to do. One of the most important things that we're going to have to do here, and again, I'll repeat, it's very hard, is finding the right balance between privacy and transparency and accountability.
Absolutely.
And I don't pretend that we're going to succeed, and I don't pretend it's going to be easy, but if we do, we really will have done something here.
Would you say then the synergy, at least in terms of relationship, and they don't always pull in the same direction, though, it's accountability, transparency, privacy?
Yes.
Okay. All right. So what I'm going to do is I'm going to assign groupings to you. Now, in this exercise, you're going to have the synergies that we identified, but I also want you to take in the entirety of the 9 list. So the exercise isn't losing anything, it's just making sure that we're identifying where we see close relationships. In doing so, I want you to reflect on your mandate in the terms of reference, and within that grouping, I want you to come up with what you feel is the recommendation that would help the child death review process. So each group is going to come up with 2 recommendations, likely anyways. I'm not going to cap it on you, but there's likely going to be a minimum of 2 recommendations based on the groupings that you are assigned. The best way I see this moving forward is probably just what Peter did in his explanation. He gave a sentence, and then he filled in details under that sentence. So as you are forming the recommendation, I want you to come up with the recommendation and then give us the details as you see them. I'll give you cards in order to do so. Once your group comes up with that, I'll give you roughly half an hour for that exercise. We're going to present back, and we're then going to have discussions around refinements and seeing where we have consensus. Does that sound good? Are there any questions about that? You're basically going to get assigned a grouping. You're going to be responsible for forming the recommendation and then presenting it back to your fellow colleagues. All right. So this group here, I'm going to give you this flip chart. So you have the role of the OCYA duplication timelines, as well as the accountability, transparency, privacy pieces. And this group here, actually, we only ended up with 3? Dang. All right. And this group here, I'm going to give you the family supports, the cultural, and the family inclusion. So if you get done early, we'll talk about how we're going to vet these guys, okay? Sound good? All righty. I'll hand out some cards. Remember, reflect on your mandate, terms of reference, and make sure that you're coming up with recommendations that fit those purposes. And we'll go from there. So roughly 30 minutes for deliberation on this.
Anybody got good penmanship? Do it if you want.
I'm going to bring everyone back together. So how this is going to work is I'm going to ask one table to present to the other in terms of recommendations they came up with. We'll go through one recommendation at a time. We'll ask if there's any questions of clarification to start. So, going through some of the principles we've previously talked about, we're going to seek to understand. We're not going to make assumptions, so we're going to ask questions of clarification. We're then going to see if there's any objections or enhancements that you see can be made. And then we'll see if there's agreeance in terms of the recommendation, at least at this point in time. Full well knowing, we've drafted these. There'll be more review to come. Alrighty, so it's going to be questions of clarification, any objections, enhancements, and then if there's a level of agreeance that we can stick with at this moment in time. Our goal is to get through this by lunch, and when we come back, certainly to have this back to you for a more thorough review. Sound good? Alrighty. So you guys had a few more items on your list, so I think it might be more prudent if we start with this group. So can you take us through your first recommendation? Peter? Oh yeah, and please speak into the mic. Thank you for doing that.
Okay, can you turn that so I can see it?
Yeah.
Okay. Yeah. So we started with the notion of the external accountability with the OCYA as the principal agency for that accountability. And so this is sort of in the order that we discussed it. And so we'll ask for your patience as to hear the whole of what we say as a group. So we felt that there should be removal of duplication in terms of the fatalities, so the removal of the Council for Quality Assurance, fatality reviews. I don't see fatality review there. Oh, fatality, okay. And the family violence death review process in respect of children, so that there would be the single agency responsible for the review of the death of a child in care or within 2 years of having received services. So in terms of authority, the advocate would be the legal authority would have the legal authority to access all information from any source within provincial purview, such as AHS, Ministry, DFNA. And the OCYA must investigate, so the change here is must, investigate all preventable deaths of children receiving services or who have received services within 2 years. So the ability of the OCYA to cherry pick the cases that they want to work with would be removed. They would have responsibility to remove all preventable deaths. The Auditor General recommended the OCYA reports to a committee with increased powers, and the model that was talked about is the Public Affairs Committee? Public Accounts Committee. And there is some necessary discussion about structurally how does that get done. But the notion on this is that you are shrinking the responsibility for death review into a single agency, and so that single agency requires also a good mechanism of accountability, which would be to this committee of the legislature. The recommendations would need to follow the SMART model. And in other words, the notion being that the recommendations from the audit or from the OCYA would have to be actionable, either by the department delivering the service or by some legislative action. The focus would be to look at strengths and deficits of the system in the case, with the report to make recommendations to ensure increased transparency and public confidence in the system. Timelines subject to the, in the event that, for example, a criminal investigation precludes an investigation or pursuit of an investigation, that every 6 months, well, essentially, no, every 6 months, the OCYA is going to report to the Legislative Committee where they are with the open cases. And if there is a case that they cannot proceed with because of, for example, a legislated bar or criminal investigation, they would report that the case was on their radar, but they couldn't go any further because of the criminal investigation. And that would improve the timeliness of to the public of what is happening in terms of the review of a case. And then we did talk about culture and family, but I think that the other table pursued that in more detail. So, fellow colleagues, have I covered it correctly? Missed anything? Okay. Okay.
All right, I think you got 2 thumbs up there, Peter.
All right.
So, in terms of this table, the first question is, do you have questions of clarification around anything that was presented? David.
I'm curious to know why we wouldn't trust the OCYA, an independent officer now of the legislature, to make choices about where they're going to expend a tremendous amount of time, energy, and resource, and to not necessarily include a full review of those deaths in which it was very consistent with the previous one that they had seen. I hesitate to suggest that the 40 staff are already saying that they're fully occupied and that they make choices on the basis of what they think they can add value to, and with their experience, I think they are capable of making decisions about what deaths I mean, they all get reviewed at some level, don't they? Every one of these gets examined at some level, and the decision then to do a full investigation is I guess what you're talking about. And I think I wasn't as sure of this before the Child and Youth Advocate was independent of the department. Now I'm much more confident that they can make decisions that will not compromise new information and new recommendations and changes that are needed.
So can you provide more clarity around that point?
So I don't think that it's written in stone that, so this is still open, right? But I think that one of the issues with transparency and public confidence is the decision to investigate or not. And specifically when I think about a family's perspective, it might feel that nobody cares because an investigation was not done. I'm not saying that every family will feel that way, but saying, oh, this just happened before, it doesn't add value to us, I don't think it takes into perspective or into account the family's perspective about, but this is my child. And something different must have happened, because otherwise they wouldn't have happened again if we knew about it. So part of the public transparency and accountability piece, I think, is that every preventable death is investigated.
Okay, we're going to go Jason, then Peter.
The other thing I would add to what Patty said, David, is my concern is the patterns, the pattern. And so if we're going to try to empower the office and a standing committee of the legislature to try to prevent, I mean, the main goal at the end of this should be, one, what happened, but second, to take the information from what happened and ensure that we begin to make adjustments in the system so it doesn't continue to happen. And I think to do that, there's a tremendous amount of value to the fact that maybe 5 or 6 cases keep coming in the period over and over and over with the same recommendations. That to me is very valuable, because now the question is, well, why the heck haven't we fixed it? We clearly, whatever is coming out of the recommendations is not working, and there has to be an adjustment at that point. And you won't be able to see that if you don't look at all the cases.
And Peter?
I think one further comment, David, because I think your question is actually quite valuable. The advocate has demonstrated a capacity to choose different methodology for. So, for example, on the Sleeping Together report, they were able to do that in a more truncated fashion in order to examine a pattern that was taking place and consolidate some cases together. In the suicide report involving Aboriginal youth, they were able to take 5 cases and bring them together in a thematic way, to the point that I think Jason was making, being able to say we've got a cluster of cases that are helping to illustrate a concern within the system, and we'll examine them as a cluster. And then in the Baby Annie case, we saw how the advocate was able to say, this is a case we need to probe in a more in-depth fashion. So I think that by not saying what that investigation has to look like, we leave methodology to the advocate. We give the advocate the flexibility to utilize the resources effectively while ensuring that transparency and accountability piece.
Does that hold it for you, David?
Is that different from what he's doing now? Are we suggesting anything different from what he's currently doing, reviewing all the deaths and deciding which ones will potentially add value to
We
change?
are saying you're going to have to report on all of the preventable deaths. My concern, and I think that Jason was trying to go there, or maybe Patty, is if the advocate says, this case doesn't warrant me to do a full investigation, but I'm obligated to investigate. And one of the reasons why it doesn't require a full investigation is because I've seen this problem 2 or 3 times. Then the advocate, by being required to still give this some public attention, the advocate can then utilize that as a mechanism to say, I'm presenting this case in a mechanism by which we are contemplating trend. And thus, while I'm going to spend some focus on the particular case, the particular circumstances of this child's death, I'm going to bring in the prior cases and discuss it from a trend perspective. So the lesson learned is going to be less from perhaps the particular case and more from now the connection to the prior cases, because as you identified, sometimes he says, I don't know that I've got something new to learn per se, but when I link it, then I have something different to say. So the difference is this requirement to say, yes, you're going to have to talk about all of them.
Do we know what proportion of deaths that he currently reviews? Does anybody have that sense?
We don't know. Okay. All right, I'm going to go to Graham, who's been patiently waiting.
Thanks. Just kind of sort of expand on what Peter was saying and just show the parallels, which I know Jason has talked about. Like, for example, ACERT, who's an independent body, there's a trigger, right? Like if there's an incident with a police officer, it triggers ACERT to do an investigation. And there are many times where ACERT does an investigation and really quickly finds out that there was no negligence, and the reports they're saying we have nothing to add because all the steps were taken appropriately. However, it creates that public confidence that we are looking into this, and so it's a similar thing with the child and youth advocate, where the trigger will get pulled as soon as a child who dies in care, or when a death with a child in care happens. However, as the process occurs, they'll realize that it may not warrant a full investigation, but it allows that public confidence to exist there as well.
Okay. Other questions of clarification? For anyone from this table have another question of clarification around any of the recommendations that were put forward? Okay. Is there any enhancements or objections that you'd like to offer? Do we have a level of agreement that at minimum we can live with what was put forward? So support or live with? Yeah. All right. Thank you very much. All right, so we're going to shift from this side of the room to this side of the room. So please, we're going to follow the same format. We're going to present what our recommendations are. We are then going to go through and ask for questions of clarification, any objections or enhancements, and then level of agreeance. So Maria, you have the mic. I'll let you begin.
Okay, I'm going to start with the first one because that was the one I did. And we didn't do it the way you did. So as I'm sitting here and looking at what the other group did, so I'll read what I've put, and then I'm going to make some comments on it. Okay, so identify family members, caregivers, frontline staff who are part of the child death review process, so a particular case. Identify any safety issues of those impacted or involved, and then involve those identified with respect to the appropriate parts of the review. So my thoughts were, if in fact a death review process is going on, if there were other children in that particular home, are they at risk? What other things that need to be done with respect to that? I felt those were included in that. In terms of who would have the authority to do it, my initial thought was somebody who would be perhaps a unit supervisor that is not involved in that particular case. And then I thought, well, actually the OCYA may just take the whole case file and do that review. But I think it's important to identify every specific person that's involved in that case. And then you kind of make your decisions on where people are impacted and what parts of the process they need to be involved in. Okay, so now if there's any questions.
Any questions? Any objections or enhancements? Jason?
Just a thought, maybe, and it's coming to me as I look, because I think we all agree with the intent of everything that was written there. I'm just trying to see it within the review process itself, because to me, that's something that has to happen automatically within the system. We have a child that has been, possibly killed. It seems to be the system, and I suspect has to make sure that that is happening. Whereas we're specifically talking about the investigative side right now. So part of this is phase 2, but for the phase 1 portion, are we saying that the child youth advocate, if that's the model we go with, is responsible for making sure that has taken place? Do you see what I'm asking? How does that directly apply with the investigation?
So back.
Okay, and again, I look at it from my lens of having worked in corrections, right? So I believe that every single department that does service has a process in place if anything happens. And certainly that's what happened with mine. So for me, it would not be, if it happened in my case, it would not be my supervisor or my unit that would identify all the base materials that needed to go for a review. There would have been an internal review anyway, whether there was somebody outside doing it or not, but they would pull all those things together. And in fact, if the police came in to do an investigation, all of that stuff would be put together right away. And none of the people who are directly involved would be involved in providing the information, but they would be identified as people to be included in the investigation. Does that answer your question, Jason?
Is there a follow-up there?
Yeah, real quick, I think that it answers my question. So, but what I'm hearing or what I'm thinking as you say it is, are we saying that possibly there's two things that would be triggered then upon the death? So we have the process that we just talked about, obviously, but that second there has to be something that's made that would automatically trigger to do what we're talking about here. So, for example, I think in the case of construction fatalities, an investigation team would be being sent in to investigate the fatality. Mm-hmm. But at the same time, counseling and that whole group would have been triggered to deal with a separate issue during the process. And is that what we're saying here, or are we saying the child youth advocate would be responsible for that? I guess that's what I'm asking.
Okay, so initially, I thought it would be a unit supervisor from another unit. And that may be the case, but because we've identified the OCYA as kind of the overall authority, but to get the information, he still has to get it, or she has to get it from the department. So I think that it still should be somebody in the department that's pulling that together.
Okay, Heather, you had your hand up.
So I think I understand this. I mean, I think this is stemming from a conversation, Maria, correct me if I'm wrong, that we have to ensure that we're looking at the cultural identity of the child that's affected. So if we are doing that, then our recommendations and everything that is coming out of the report needs to make sure that that lens is supported. And so to do that, we obviously need to be able to identify, who's involved with the child. But like looking at the safety component of other children and things like that, I think is outside the scope of the death review. That's part of the stage 2, like how do we ensure that licensing and stuff is in place. So.
Okay, I'm going to go Rick and then Patty.
Thank you. What's there, I agree with, and thank you for that work. And testing it against our sheet of 9 here, the section I'm looking at is F, family supports. And on the top line, enhance culturally appropriate supports for families, I think that is there, reflected in here. The other 2 bullets could be reflected in there. I don't see that they are, and that's probably the intent, but, families define what family means to them. I don't see it reflected there, and supports are ongoing, available at any point in time. Now, and I appreciate this is somewhat limited by any point in time is limited by the death review process. So I'm assuming, and I'm just looking for a confirmation from the other table, that these 2 things were intended to be reflected in there. And are they confident with what they've written here that those things will happen without being explicitly written there based on that? I guess that's what I just want to check against.
Rick, actually, they're identified in the other bullets that we have.
So right now, there's another one here. So
Yes.
right now, you're only speaking to
Okay,
this one, right?
all right.
That's right.
Then I'll wait for that. How's that?
Thank you. Patty?
Thank you for that correction.
Okay.
So my question is around the difference between an external review, which is that, and the internal review, which we have not even contemplated yet. And so do you foresee this being a part of the internal review? Because it's with the department, it's not part of the external review.
That's correct.
Okay.
Yeah.
Okay.
So I'm just going to make that note. So I heard internal review.
Yeah.
Part of, anyways.
Mhm.
Okay. Any other questions or clarification? So now to go back, objections or enhancements that you would make here?
So it's my understanding that the internal review is file, paper, and staff currently.
Yes.
It's my understanding that the OCYA is the body right now that interviews families and includes families. So are you saying now that the internal review is going to be a family process?
Okay.
I'm just wondering.
Yeah. I think there is an automatic internal review. I mean,
Right.
any kind of human services,
Right.
any kind of model, there automatically is any incident, there's a review of what went on.
Right.
So the list of people, like the OCYA wouldn't have that list until he gets it from the department. So that piece has to be identified before, like that's all part of the information that goes to the OCYA.
Right. The
Now,
file would.
Heather may be able to
Okay.
say something further on that.
I actually was hoping Joni could maybe clarify the process.
For the internal review?
Yeah.
examination, thanks, is intended to, first of all, make sure other kids are okay, family is informed, the work site knows what steps to work through with that family and with that community around how we help with funeral arrangements and what do we need to tell families about publication bans. And we check that staff are okay and bring in sometimes debrief, critical incident debriefing, those kinds of things, or whatever the community needs and that staff needs to be supported. At the same time, we're helping them pull together the file information, so we have all of the documentation and the electronic record, and we start to help them pull that all together and what files are going to be necessary for two things. One is for our internal process, where we start to complete an initial examination, which includes, it's somewhat of a chronology of the circumstances related to that child and their family. And the second is because we provide that information directly to the Office of the Child and Youth Advocate when it's prepared. But preparing that initial examination is also an inclusive process in terms of talking with community, talking with staff, because we want to know, is there other information out there about what we were delivering that isn't in the file that we need to be considering. That forms the initial examination, and all deaths, including what the panel is now considering preventable deaths, right now in Alberta, all deaths go through that process. The determination that the statutory director has made to do a further review on other deaths was related to patterns, identification of some potential systemic improvements that could be made, and has landed on two fairly broad themes with two populations that continue to emerge that we're worried about. And I'm getting to the family piece right now. In those circumstances, the Office of the Statutory Director has met with those communities already and those leaders and those staff to say this is what the actual, my more in-depth investigation process will look like. How do you want to be engaged? Who do we all have to talk to? That process has been initiated and yet to be completed. We would consider those internal quality assurance processes. The OCYA, from the moment they get a report of death or serious injury, that we have mandatory reporting to them, and it happens within the expected time frame. The report of death gives them a bit of information. They know that they're going to get the initial examination once it's completed. Plus, because they also, for the purposes of investigation, but also because they do individual advocacy for kids with open files, they have direct access into our information system. So there's nothing that they can't, that they don't have access to already, other than paper information that they'd be waiting on. We take all that file information while the initial exam is happening, and it gets copied and it gets uploaded for the OCYA to actually have the paper file too. So those two things happen concurrently. Does that answer the question?
So what you're saying is there's actually three processes. There's pre-review, where all of this, there's identification, and there's family, all of this information is brought together.
Mm-hmm.
And then the initial examination happens, and after the initial examination, that information is also given to the OCYA. So, okay. So there's a pre, and then there's an internal, and there's an external. And I think we're on the pre at this point. Identification of family members, all of that is done by department staff before the review even happens. Yeah? Okay.
Bruce?
And if I could just build on that too, I think this recommendation would definitely reflect that internal pre-work, but I think the recommendation also would be to the Child and Youth Advocate that this would be a critical element to include drawing from the information coming from the other internal review. So based on that, families need to be involved in whatever way based on safety of the family members for involvement.
Okay. Any other questions? Any responses to what Bruce just added? Okay. Any enhancements or objections? What's our level of agreement here? Is it something we can live with? Is it something that we support? Is it something we don't support?
It's good, but it's
Pre-review. Any objections? Okay. All right, next one.
Yeah, and I guess my assumption was that the second point relates to the internal, and the external review. I didn't distinguish between these three levels of review. To ensure the biological and/or adoptive guardian family is engaged early in influencing decisions regarding the death review process.
Okay. Questions of clarification? Peter?
I like this idea. There are other potential caregivers you're not including. Is there a reason for that?
Only that I thought we were focusing, based on the material we were given, on the family. Making sure that the family, biological and adoptive, were
Okay.
actively included early.
I mean, I can think of
Not exclusive.
Yeah, I
It
can think
wasn't
of
meant to be
examples,
exclusive.
David, of foster care who have had the child in their care for an extended period of time.
The foster word should be in there then.
Okay.
Yes, absolutely. All levels of family involvement, yeah.
Yeah, but
I was
there
gonna
may
put
be two
all
different
levels of
definitions of
family.
family there.
Guardians.
Guardians, yeah.
That should be more explicit, I agree.
Yeah, I know we talked about family, how family defines, but at some point as well, biological family is probably not going to define family to be inclusive of foster family. And so you might have you'd be putting some pressure on families to seek coalescence around who's inclusive at a time when that may be a very difficult thing for family to do. That's why I'm trying to be more inclusive in this.
Right, and I guess that's why I used the word influencing, not determining who gets included, but they should have some influence, I guess, and somebody has to decide who actually ends up having what influence in this process.
Thank you, David. Other questions of clarification? I think we already have one enhancement. Is there any other objections or enhancements for this recommendation? Okay. Levels of support is something we can live with at minimum. All right. Next one.
The third one that we're looking at is, again, trying to be specific. The context for this that we're trying to understand is when I think about a thesis defense at university, made up of different members on the panel, there has to be one person that understands methodology of the thesis. There has to be somebody else that understands the substantive topic that's being talked about, whether it's child abuse or whether it's foster care or whatever. There has to be somebody that really gets it. If it's really looking at Indigenous people, there has to be somebody that understands that research, that content area. So in a similar way, our recommendation here is that each investigation includes a minimum of one member who represents a specific culture and community of the investigated child and or family. If Cree, then Cree. If Sudanese, then Sudanese. Patty, thank you for that. I quote that all the time now. When I look at that, too, it also raises issues of complexity. But I don't think we should get bogged down in that. So, for example, your example, I think, was, if this was a Cree member of a First Nations who's actually lived off reserve for 30 years, then there would need to be two members. Somebody that understands the fact or kind of the reality of life off reserve, somebody that really understands the traditional Cree worldview. So let's not, just let's look at having more rather than less. Not a specialist, but people that have content areas that can add to and build on this.
Which would speak to also the language around minimum of one.
You bet.
Okay.
Make sense?
Yeah.
Yeah.
Questions of we'll find out. Questions of clarification. Debbie.
I thought it just occurred to me, I'm thinking my own experience, about the role of not just culture, but religion. If one of my children were to die, I would never want them to be treated or have their death process through the lens of the religion I was raised in. So that could be, an issue for those who, maybe have some different things. So I don't know if there's a way to make that a little more inclusive, but it's just a thought that occurred to me.
Okay. Bruce?
It's a good point because we want it bigger rather than tighter. So, if we can find a way of describing culture and community and living circumstances and spirituality and beliefs, that's what we're trying to get to, right? And I don't know if there's a good descriptor, but let's pay attention to that and make sure the recommendation reflects that because you're absolutely right.
So in terms of, the massaging of this, we need to think of something that's, inclusive of all of the factors that might form one's identity.
You bet.
Could I just add to that maybe it's not just the investigation, but whoever holds the pen, the person who gets to write the report, that there is this level of cultural congruency and understanding that oversees the writing, because the power is in the pen, right?
So it's
Dam-
not just the investigation, it's the person who holds the pen.
And if I could just jump in here, Damien, we are at noon, and I recognize that there may be people who have other commitments, that we need to hurry this along. So I don't know if we have enough time to finish that off, or if people have to leave.
Okay. We have only, I think, one more. I don't know how much time it'll take. These are roughly taking anywhere between 5 and 10 per. I guess I would ask, is there any other objections or enhancements on this one? Is there a level of support for this to move forward for further review? Yeah. Okay. So then, if I can steal 5 minutes of your time, and I won't do that without your permission, but if I can, I'll just ask. We have one fourth recommendation, and if you can quickly speak to it, whoever wrote it.
Yeah, that was me. This was regarding the fourth bullet point for item number 2, about recognizing the grief and loss for families. So, and I was kind of thinking out loud here, just in terms of how do you support those families and communities? And it was kind of like getting back to what I had mentioned in Calgary of providing like a menu to families. That perhaps, and I don't know the entity that might necessarily provide this, and perhaps the OCYA is the right one, perhaps it's not, but just ensuring that there's sort of some kind of public-facing aspect to providing supports for families, like the grief counseling, that kind of thing.
Okay. Questions of clarification? Jason?
I completely agree with the intent of that statement. The one thing I want to throw at is, and I don't know the answer, but can the advocate do both those jobs? Can they truly advocate for the child, investigate what's taken place in the system, and then advocate for the family at the same time? I think, going back to some of the first people that we heard from in regards to that, there was definitely some clear conflict or frustration, at least from the family's perspective. That may have just been perceived, but it was there. So I don't know if it needs to be under the advocate or if we need to say that this literally needs to trigger a separate, maybe it's somebody that works in the advocate office, but somebody that should be just focused on trying to walk the family and the community through the process. I suspect it's tough to do the investigation and keep care of the family.
Other questions? Any other questions of clarification there? Bruce?
When I read that too, I fully support it. I think it's ideal to have a menu card to make it front of mind at all times. That support for families is not necessarily something that needs to happen on week 1 or week 37. It happens when it's right for the family. But somebody needs to be paying attention to that it's almost an expectation that it happened at some point, whenever it needs to, if it needs to.
Other questions?
OCYA, I would see being the person that would say, are we paying attention to this? But there are a lot of other great organizations that would be doing that work.
Okay. Any enhancements or objections to this? The only thing I've heard is that, in terms of Jason's point, was it should be separated from the investigator.
Yeah, I just thanks, Jason, for asking that question, because that's, I had the same question. I don't know if OCYA is the right one, but considering the time, I just wonder if that's something we can kind of leave for the afternoon, perhaps, or another time, because I know that people have to get to other places right now.
Okay. Do we have at least a minimum level of support to bring this forward for the afternoon? Yeah. All right. Thank you very much. In terms of the afternoon, we'll come back. We'll continue with our review of what you wrote down. On the agenda, we have 3:30. We'll reconvene the meeting.
And there is lunch to be served for the panel in the Cambridge room and for staff in the York room. And
Thank you
We'll
for
see you
giving
later
me
on.
5 extra minutes.
can I call the committee to order? Hello, everybody. We're going to call this afternoon session to order and reconvene and pick up where we left off this morning. And Damien will continue to guide us through. So take it away, Damien.
All right, thank you very much, Madam Chair. So a couple things to start. Quick recap of where we started this morning. Of course, we started with the review of a document that was put together, and we said, you know what, we're going to put that to the side and go back to where we were at the Calgary meeting. So we took the 9 statements that were generated at the Calgary meeting. We looked at some synergies and we broke them out and had some conversations around there and developed recommendations based on those 9 statements from Calgary. Of course, we started a review of those statements and we almost got through there, but then lunch came around and of course we have many priorities. So we didn't quite get through all of them. We have 1 left to review. Again, when we do review, it's questions of clarification, objection enhancements, if there's a level of support in the room to move forward on it. In terms of that being the morning, in terms of this afternoon / evening, we basically have to review this last recommendation. We then want to review the recommendations that were created versus the Calgary material, make sure that we captured everything we said we were wanting to capture from that meeting. We also want to review it against our terms of reference. We want to address anything that we think may be missing or may need to be enhanced and refine our recommendations. We want to do a final holistic review around what we are recommending, and of course we want to debrief the experience. So that's basically what we have on the agenda from 3:30 till 8, plus a break for dinner.
We should also... We had started compiling a list of things that we need to talk about that haven't made the list yet. So
Absolutely, so we'll get that in the address refine.
the address refined? Sorry.
Yep.
Got it.
So I do have the list of things that we said were missing earlier, and that might also be enhanced by our review of the Calgary material and the terms of reference. Alrighty, any other questions about our agenda this afternoon and this evening? So we're scheduled to take our first break at 4:45, but until then we're going to just start chipping away at what we have on our agenda. So the first thing up is reviewing this last recommendation that we came up with. And I've asked Cameron if he can speak to it once again, just refresh our memory, what it is, where it's coming from, and we'll go through our line of questioning.
Yeah, thank you for that opportunity. I think, and I want to clarify what I meant by public facing, because I realize that may be ambiguous. I guess what I meant was something that the public can see what types of services perhaps the OCYA offers families who may be grieving, so that like on the website it might say, you know, if you are a family, here are the supports that are available to you. So that's what I meant by public facing. You know, just in our discussions, we've talked about ensuring that there are supports for families that are going through the grieving process, and you know, just attempting to try to be more specific in our recommendations. That's sort of what I came up with, and so that's where I was going with that.
Thank you. So going back to our process from this table, are there questions of clarification that we have around this recommendation? Patty?
Can we just maybe, it's a word that we might be looking for is accessible or well advertised or something like that, because I think they need to be accessible for sure. Thank you.
Okay. Other questions of clarification? So then the next question, do you have any objections or enhancements that you'd make? So Patty already kind of made an enhancement saying accessible might be a word that's more relevant instead of public facing. Are there other enhancements or objections that you'd have around this? Debbie?
I'm kind of wondering if accessible is a strong enough statement for what we want to say. It's not just that it's there and if anybody wants it, they can have it. It's more that we want to actively, you know, ensure that families are aware of these options, they're able to, you know, like maybe a little stronger. I can't think of a word offhand, but.
Jason?
Yeah, I think, I agree that it should be a little stronger, but also I think we're not just saying that we want them to be aware of that we want somebody to be responsible, make sure that they're aware of it, sorry, that's better. I think I would have learned how to talk on a microphone by now. That somebody's responsible for it as well. Like, I don't know if we've established that. Maybe it is a child and youth advocate. I just don't know. But I think we want to make sure at the end of this that somebody's clearly responsible for getting it done.
So there's someone responsible. Cameron?
Yeah, I agree with Debbie and Jason, and maybe a word for that could be proactive.
Proactive.
I don't know if that captures it for you.
Does that hold the intent? Because we could wordsmith all day. It's one of those things that can go on forever. But do we conceptually, does it hold the intent? Debbie? Patty? Bruce?
Yep.
Okay. Alrighty. Any other?
Actually, yeah,
Oh
I will, unless somebody else was going.
no, you're
No,
up.
I guess continuously available. So it's not on any schedule, that it's not at the beginning or mid or the end. It's available at any time. Family decides when it's the right time. So some way of describing that.
I'm just going to put down here, family decides it's the right time. Peter.
And just to continue with this comprehensiveness, but it's family as defined by family. So we're not going to say that Uncle Joe can't be part of it, kind of thing.
Okay.
I'm not really sure if I'm comfortable leaving it with someone responsible, and the only reason why is that I do believe this should be part of the advocate in that for the comfort of the family, just for the there's a little bit of a separation from the services. So if we're talking bio family, there still may be some grieving around losing their child at the beginning, you know, and then the death of the child on top of that, and it might be complicated if the department holds that responsibility. And so I would say that the advocate might be the right place to have a department that is about supporting families. I'm not saying that the department can't do it. I'm saying where family comfort might be.
Jason?
Don't disagree with that. The one question I have is thinking back to when we were talking with the people from the advocate's office, and several of the families have been through the process before. I'm still struggling, and maybe it's not our job. Maybe we could just recommend it. They got to figure it out. But how you let that office be able to balance the tremendous responsibility of advocating for the child, and sometimes there could be family issues, and that they may be in this conflict between their two priorities of who they have to advocate for. So I agree with what Patty's saying. I'm just struggling with how to do it. So.
Other thoughts? Peter?
I don't have an answer for the struggle because I share the same struggle that Jason and others are describing. But for me, part of the battle is how much direct service delivery are you wanting to shift into the advocate's office beyond their role of advocacy? And so, or should we mandate it somewhere else within the ministry, but mandate it? Yeah, but I'm concerned about recommendations coming from here that are shifting too much service delivery over to the advocate's office.
What, I see the staff nodding. Do you have any feedback for us about where that could sit? Yeah, I mean, I'm even thinking maybe in the human services ministry as opposed to children's services. And maybe the service delivery could be in human services and not in the children's services ministry, something like that. Would that make sense?
Floor is yours, Joni.
So, I don't need a microphone, I don't think.
For the,
Do I, oh, sorry. Just because people are listening. Thank you. So it partly depends on, I guess, what the support is for. And if it's for the grieving process over time, it's potentially that they need some ministry to give them the resources to make sure that they can access whatever it is that meets their needs, whether or not it's ceremony or therapy or those kinds of things, because it'll look different depending on the family. Or is it partly navigating what happens next and what happens next and what happens next? So, you could give that to different people depending on what the primary function is and how long it should be.
It sounds like the department does the what happens next already, and maybe, okay.
Yeah, to the extent that we can, and families are interested in doing that. But if a family 10 years from now, if a child passed away, family 10 years from now wants to re-engage in some sort of help for grieving, the department probably wouldn't be in the position to offer that the way it stands right now. So that's kind of where it would be. If we're still involved with the family, though, that's a different story.
Okay, I'm going to go Nicole, then I'm going to go Bruce.
Is this perhaps something that we could leave at the discretion of the minister?
So feedback for that before I go to Bruce.
I think that if you think back to the families that we spoke to about this, I don't think that they would like that answer, or that it would be adequate enough. I'm not saying that it couldn't be under the department, but I think they would want something that's more public facing or a little more solid than we're just going to leave it on the minister. I mean, quite frankly, it is under the minister right now. And clearly we had lots of families come and say that they were uncomfortable with it. I'm not saying the minister or the ministry is doing anything wrong, but that was pretty clear that people would like to see something shored up there. I don't know what it is still. I'm still struggling with it. But I do believe, like that says, it has to be a little bit public facing and pretty clear how we are suggesting that the department tackle it. I think they need more direction from us, sorry. We may be able to give it to the ministry, but we need to make it clear what we're asking the ministry to do, I think.
Okay. Peter, you got a comment on the same question?
So I want to just go back to Calgary. In Calgary, we had a consensus that was around families, as defined by the family, going through the death review process would be supported. That was our consensus. And today I'm hearing we want to ensure that that's written in some fashion, that that's not optional in terms of being offered. It can be optional in terms of whether the family accepts it. But we want to say to government that offering that service as the death review process goes on is something the government will offer. I don't know that it's that important for us to say it's in this office versus that office versus that office. I think what's important is the principle that we agreed to in Calgary is that they will have the service and the government will be obligated to provide that service if the family elects to use it. I think that's where we were trying to get to in Calgary.
Jason, you got a rebuttal there?
Not a rebuttal, agreement, I think.
Agreement.
And I was actually just looking through some of my notes from before, in just regards to the youth, the child and youth advocate being the office. And I had a couple comments that I noted for some people where they felt that the office was actually sometimes felt like it was a buffer between the department and the families during the process. So, and I'm not saying that's actually the case, but that certainly was a perception from a lot of people. So going the way Peter says, that kind of keeps it separate, but ensures that families are kept care of. So I certainly could support that.
Okay, I saw a lot of head nods. We'll move on to Bruce. You had a comment.
Yeah, and this kind of builds on what everybody has already talked about. My thought would be that it be monitored by the OCYA, that they ensure that it is happening for an investigation. I think the go-to fallback position would be the Children's Services would offer it if appropriate. If not, then there'd be a menu list of other options that families could choose from. So it could be Alberta Mental Health, it could be mental health walk-in counseling programs, it could be just a range for that community itself. And it doesn't matter when it happens, it matters that it's there, it's available, and it's accessible.
Is that fair?
And OCYA would be making sure that it is, being followed through on, that it's an access. Your point about 10 years from now, that would be a good point too. They might come back and say now's the right time. At that time, there's a menu list of children's mental health or walk-in counseling programs that they could access and still be available outside of the ministry.
Okay. Okay, so any other enhancements or objections that we need to discuss around this recommendation? Debbie?
This is more of a question. I don't know if we did cover this. In these situations, can they access like victim services and victim services compensation, those kinds of things? Does anybody know?
I'd look back to Joni on this one.
Depending on the nature of the death, they could, in fact, receive supports through victim services. And then there's the Victims of Crime Fund as well that can come into play later, but it would depend on the nature of the death. So victim services does play roles even in situations of death by suicide, but are they long-term and enduring healing rules, or are they helping them through the... So yes, they wouldn't be disqualified because they were a death that involved children's services, but that may not be exactly what is being imagined here, not to say that they couldn't.
Okay. Does that hold it for you, Debbie?
Yeah, I was just curious if there's overlap that we were straying into.
Okay. So at this point, I would ask, what's our levels of support for this recommendation? Is it something we can live with? Is it something we can support? As in terms of, we're not sure necessarily who's responsible. We did have the idea that it might be watched over by the OCYA and implemented by government. But what we really said is when it comes down to it, we want to make sure that supports are available when family defined by the family decides it's the right time. Is that something we can support?
Sorry, I just have one more thing. Is that when I look at that, I think maybe my discomfort is that oftentimes in history, for Indigenous families, there's been services provided, and they've been provided from a worldview or from a cultural construct that made no sense, and then they were just there, and it was like, here, this is what you have, and if they don't take it, it's like, I guess the family didn't want it, but really the family wanted something different. And so this was where is this being placed and how is this going to be done? But I would like to then just add culturally congruent supports or culturally appropriate supports, so that there is an opportunity that if the menu provided has nothing of interest, there's still an option to find something that'll work. So I'll leave that there.
Okay. How do we feel about the addition of making it culturally appropriate supports? See head nods? All right. So do we have a level of support from everybody on this piece? Verbal, physical cues, head nods? Yes? All right. So, we've added several enhancements to this one, including continuously available to family, defined by family when they decide it's the right time, and the culturally appropriate supports. In terms of when we get to this exercise over here, I'll ask that you hold those things in your mind. These cards are only meant to hold the ideas. They're not meant to be verbatim or give you everything as you've spoken to, but just to hold the ideas behind your discussion. Nicole. In what way?
Well, I just have some questions about two of the cards up there, and I appreciate that I wasn't here this morning, so I would ask the indulgence of the panel that if I could just ask some clarifying questions for them.
I would put it back to the panel. Yeah, all right, ask away.
Thank you. Okay, so I have them here. In B, the identify family members, etc. I just want some clarity around, it says internal and external. Is someone able to clarify that for me? What the intention was there?
Bruce?
I think looking at three different levels, so the internal review that happens within child welfare, the a formal stat director's review, and then also the external that would occur with the OCYA.
We were more looking at how information was collected and shared. So before anything happens internally or externally, there's a lot of information that is gathered by the department, and that's kind of pre-investigation. Then internally, the initial examination is done, and maybe a statutory review, and then an external review done by the OCYA. But we were trying to figure out how information was gathered and how it was shared. And when we said pre, that was kind of even all of that information is going to be used in both examinations. But we were looking at it from a when is the information gathered, at what time, and then how is it used in the internal and the external. Does that make sense?
I guess my question about it is just ensuring that any family's involvement with the OCYA review would be, I guess, the absolute most transparent and making sure that everybody's involved. I'm just concerned that having the internal and the external is creating duplication again. And that's something that we've talked about quite a bit here, is that there is such a duplicative process. When I see that, that's what I'm thinking. So I've got some concerns with that internal, external.
So would anybody care to speak to that? Peter?
So at the risk of trying to repeat what Joni described this morning, so feel free, Joni, to fire things towards me if I'm off track here. I'm more scared of Joni than the other way around. So, okay. The internal piece is that when the death occurs, it's notifying the family, notifying staff, ensuring the safety of the other children, and pulling together the information that presently exists electronically and in paper format, notifying the OCYA, and doing a preliminary chronology. How did I do there? Okay? So that was sort of the pre-investigation gathering of data and notifying people and having them involved. So I think that's what that pre is talking about. It's a data gathering exercise. Then the stat director may also elect to do an internal review if the stat director believes that there are issues related to patterns or practice that require further internal investigation, and the OCYA begins the external process. And they have initial access to the electronic records because they have direct access, and the supporting other paper records are then sent, and they begin the process of the external review. So I think those are the three pieces that that's talking about. How did I do, Joni? Okay. So I don't know if that answers your question, but I think that's what we were thinking about when we put that up there.
So does that help answer the questions or alleviate or address any of your concerns?
Or does it just make it more confusing?
I think I'm more confused. Just because the process of the duplication is something, and I'm still hearing that there's going to be several reviews.
Can I add a
Yeah, so one of the things that you wouldn't see up on those cards is in all of the information that went under the first one. So the first piece was removing these reviews.
So if I can, in the discussion this morning, the focus was that the primacy of the external review would rest with the OCYA, and that the OCYA's mandate to obtain more information would be strengthened so that they would have access to any records involved with the care or death of the child within provincial mandate. And that they would have the capacity, that they would report ultimately to a legislative committee, and that they would be required to provide every 6 months an update on where the case was at. They would be able to state that they couldn't proceed with the case if there was a criminal investigation bar to their proceeding. But there would be public reporting of where they were at with each of the cases, and that they would report to a legislative committee that would have the ability to push them on terms of where are they with investigations, so as to ensure that they weren't sort of dragging on that, and equally push on thematic issues that may be relevant to how the ministry is operating, but that the OCYA would have the choice to decide methodology. So, for example, the examples we talked about this morning were that in the safe sleeping, they didn't do a particular formal case review. They did an overview of that as a policy concern. They could amalgamate cases for a thematic review, such as they did with the Aboriginal suicide report, or they can delve into a specific report because there are specific issues associated with practice from that particular case, but that they would be obligated to examine any preventable death that occurred within the child welfare system or within 2 years of receiving service. So that was how the external was going to happen. We didn't spend a lot of time on the internal, but the idea was that the employer has a responsibility for accountability for its operations, and thus both in terms of practices, policy, and as an employer, which I think is consistent with what we talked about in Calgary. So I don't know, so other panel members, did I sum that up well, or
Maria?
did I miss stuff, or what?
Okay, I think you didn't do too bad. But since I'm the one who put that up there, for me, it was all about better info sharing. So when I said identify family members, caregivers, whatever, what you're identifying is all the pieces of that case. And the last part of that statement, I said, then involve those identified with respect to the appropriate parts of the review. I don't expect the family to be interviewed by the internal process, but I expect that basic information about every person who's involved in the case is shared with the OCYA so they can do their investigation. So I hope that clears it up a little better.
Nicole? Sure. It's a soft answer. She's still mulling it, still thinking through.
Well, I just worry about the duplication with the family. And is it more of a process of gathering information and information sharing as opposed to, like, is that the meaning behind this recommendation?
Jason?
Does that need to be, if that is, does it need to be more explicit in?
Can you ask that again? Sorry.
Is the intent of this to be able to have information that's provided to whoever is investigating at one point so that they're sharing information as opposed to duplication and the families going through this process over and over? Like, because my recollection of what we talked about was that we wanted to have the least amount of impact on the families as possible. So if there are multiple reviews happening, they have kind of a one place. So is it more about information sharing so that those internal and external can happen? Because
Well, I didn't write it, so we'll probably listen to the table in a second, but the way I see it is completely different than that, the way I'm reading it anyway, or understanding it. I think we've identified as a group that the system falls short with families during the process, or somewhere along the line. Families certainly feel that are left behind. Communities as well, I would add to that. And I think we're trying to clearly identify that has to be a priority with the investigative process going forward. The problem is, as we've also identified, is it's tough for the body that's responsible for conducting the investigation to also be worried about emotional needs of family or the different things that are happening. So we almost need to prompt a second process that happens simultaneously, but who are responsible for caring for the community, the workers that have been involved, you know, for lack of a better term, all the stakeholders that are associated with that child.
Bruce?
But I'd like to hear the table explain it again. So
Yeah, I guess the one thing I'd go back to again is going back to Peter's point, there's only one external review, and that would be the OCYA. The other one is an internal review that would not be having contact necessarily with family members. That's just something that an organization would have the right and responsibility to do an internal review about looking at practice. What did we do? How did it work? The public reporting review would be the OCYA. Am I understanding that correct?
Okay. And you said you had 2 questions.
Yes. So my second one is around ensuring biological or adoptive families engaged early in influencing. So I think it's C.
Oh, yeah.
So it's prescriptive, and I don't think it's applicable to every single case that is dealing with a child death. And so I'm wondering if we have the value of it captured by making sure that the family is meaningfully involved in the review process is captured like somewhere else. Specifically, I guess, when I look at having it so specific, I don't think it's right to say that the family is influencing decisions in the death review process. I think ensuring family voices are heard would be more accurate.
I'll throw that back to the group.
I'm okay with that. Absolutely. That's what I was trying to say.
Okay.
Thank you.
So engage early in influencing, we're saying family voices are heard.
Two things on that. One is we can't be prescriptive that family will be involved. We can be prescriptive in offering the opportunity for involvement. Family has the right to opt out. And if we look at some of the reports from the OCYA, there are occasions where the family has chosen to do that. And so we have to ensure that family has the ability to opt out. There is a step, though, from influence to having a voice. And I'd like us to be at least intentional about saying we're making that step. Influence is suggesting that the family would have a way to influence the recommendations, to have more than just be heard, but have a way to be able to say, I think recommendations need to do A, B, or C. Having a voice says that we will have you heard. So if we move from influence to having a voice, I think we have to be conscious of that shift. And I'm not sure how everyone feels about that, but it's clear to me that's a significant shift. I think I can live with have a voice, but I think to me that have a voice needs to be a significant part of the process because it's too easy for have a voice to be a patronizing involvement.
So how do others feel about that? I'll go David, then I'll go Bruce.
I'd like both, yes. Influence, that they have a voice and they have an influence. Both are really what the intent was. There's no reason to be exclusive, one or the other. Both apply.
Bruce?
I get what you're on about, and I guess I see it as being informing the process in a meaningful way. So rather than influencing, which speaks other things to me, having that inform in a meaningful manner or a meaningful way.
Other perspectives?
I think so. And to speak to the biological and adoptive as well, but I think by just leaving it at family.
Yeah, sorry, they did make the switch. We just put it in brackets that it was actually extended to all levels of family, including foster and guardian. So it wasn't just biological or adoptive. That it was more of a family was more of a all-encompassing term.
As defined by family.
As defined by family.
Okay. So, sorry, how does it read again?
If
I
you
just
took
wanna-
it, basically ensure that all levels of family, including foster and guardians, and then what was the final choice there that you guys talked about?
Has a voice and have an influence on decisions.
Has a voice and has influence on decisions regarding the death review process. So yeah, ensuring families have voice and influence on decisions regarding the death review process would basically be the gist of it. Jason?
I have no problem with that. I'm wondering if, and we may not need to, but if we needed to add something into it that essentially said when safe or when appropriate, there could also be situations where that would be very inappropriate and not safe. So I'm assuming whoever takes this is going to understand that, but I'm just wondering if we should work that into the language.
Put that back to the group. What are your thoughts? About when
I
safe
think
and
it's
appropriate?
covered. I think it's covered by the notion that they have a voice if they choose to use it. I think it's implied that they have a voice. No, you'd like to be more explicit.
Well, I mean, there could be a situation where a family member is caused harm or under investigation for that harm, and by allowing them to participate in that could cause tremendous amount of stress for the other family members involved. That's where I was going with that. So I think there needs to be a little bit of discretion for the advocate to go, whereas if we just make it, you have to let everybody participate, technically a perpetrator could say that they would be allowed to participate. You see where I was going with that, David?
Gotcha.
Yeah.
Yep.
Yeah. So thoughts? I'm seeing head nods. Are we in agreement around when safe?
You want to add the two words at the end, exercising good judgment.
As determined by.
Okay, so I've captured all those phrases in here. One of them will hold it, I'm sure. All right, is there other questions that you have, Nicole?
No, I'm good now,
Okay.
thank you.
Alrighty. So in terms of where we're at, we've had a review, at least in terms of the draft of what we've come up with recommendations. What we want to now make sure is we're covering all the areas that we want to cover, that we've intended to cover. So I have two documents for you here. The first one I will give you is an electronic copy of everything you said this morning. So all the recommendations that you came up with that are more explicitly written out.
Answer.
Here we go again.
Yeah. I want you to study this, and then I'm going to test you on it. All right. So I want you to take that document. Oh, one more. There we go. So I want you to take that document. And I also want you to grab the what we've affectionately called the Calgary document. So with the 9 pieces of information on there, the 9 statements that we came up with. So it's that one right there, solution statements. So the job here that we have is just to make sure that we've captured all the themes that we decided in Calgary were important, that we agreed to and came to consensus to, that we want to address within the recommendation statements that we have. Of course, again, these cards up here are really only meant to hold the intent of the conversation. So for instance, the first one doesn't have all the details. That's why I gave you the sheet, to make sure that you have all the details available to you. So the question I would ask you to start, if the first A piece from Calgary was accountability, in our recommendations, have we covered the ideas that we set forth in Calgary around accountability within these recommendations? Patty?
I think it's important for A to say the OCYA is a principal agent for external accountability, because we still have this internal accountability piece that we haven't spoken about that has been tabled. So the externality is an important part.
Okay. So I've noted that on the card. I'd go back to the same question though. In Calgary, we talked about accountability as being important to us. We want to address it within our recommendations. Within the recommendations we have up here, have we addressed it? Jason?
Where we say, sorry, I lost my place, 1 sec. As per the Auditor General's recommendations, the OCYA report to Central Committee, i.e. Public Accounts Committee. I wonder if we need to add just a little more of that to make it clear that through that role, it'll be used to externally hold the department accountable, similar to PAC. And maybe it does that enough, I just don't know if it says that. So I'm looking at the rest of the group. If they don't seem to agree, then I'm probably reading too much into it, which happens.
Feedback?
I think it is ambiguous and difficult because Public Accounts Committee is clearly not the appropriate body. But what committee is, I guess, is part of what we're discussing. If there is an external review by the legislature, would it be the Family and Community Standing Committee that it would report to formally?
And I would submit that I think this panel has to answer that question as far as our recommendation. So are we recommending a forming of a new standing committee in the legislature, or are we recommending adjustment of standing rules so that families and communities can do it? We have to probably clear that up a little bit.
Cameron, thanks for waiting.
Just to throw a wrench into the deliberations a bit, I mean, another potential committee is legislative offices, because OCYA's, they report to that committee, so that's another possibility.
And no matter if it's a new committee or one of the other two standing committees, I think the only ones that would be applicable would be legislative offices or families and communities. We have to emphasize that it's to give the ability to externally hold the department to account, because currently those two standing committees can't do that where the Public Accounts Committee could. So we need to make that clear in there. It's not enough just to say that they're going to report to families and communities. There's going to have to be an adjustment to give families and communities the ability to do what we're talking about.
Could I add another comment and question, I guess? We've established the Office of the Child and Youth Advocate as an independent body of the legislature who is going to be charged with following on the recommendations and holding accountable the ministry. I guess I'm wondering now whether we do need an external body like a committee to review these when we have empowered the Child and Youth Advocate to do exactly that. And that's going to be part of his expanded roles as I understood it.
Jason?
We've empowered the Auditor General to do a lot more than that, David, and he still needs the Public Accounts Committee often to be able to hold people accountable for his recommendations.
Other thoughts, perspectives? Nicole?
I think what Cam was saying, just having it go to the ledge offices, it already goes there. I think that would make natural sense that it would stay there.
Yeah,
And-
that's where the reports go.
So the two things I heard there is, one, we need to define who it's going to. So we said to the legislative office. The other thing we said is we want to make sure that it explicitly says to hold accountable. Is that fair?
That's a new role.
It would be a new role that there has to be some details on the standing orders or where it would be. It's probably a question for Parliament Council, John, so nobody has a good answer. When we tell them what to do, they'll figure it out.
But if we make those two additions to this piece around the reports of the committee going to the legislative office and with the purpose of it to be held accountable, is that something that this group can agree to?
Is this another duplication then of holding government accountable both through the OCYA and the legislative offices? I don't think we want duplication. We've already asked the advocate to be in charge of holding the government accountable. And now we're asking a second body to hold them accountable. So I'm
Peter?
not sure if this is a duplication.
David, I thought this morning, and help me with this, but I thought this morning we were having, that reporting to some committee was a focal point for the legislature to have the legislative accountability piece in place, but also as a mechanism to monitor the advocate, to ensure that the advocate was performing the duties and the expectations around death review, so that there was a monitoring of the
Oversight.
monitor.
Oversight? Yep.
Yep.
Okay.
That hold it?
Yep. Thank
Okay.
you.
So going back, we had the questions around, do we need this, but it seems to be held. Are we good with adding the pieces around legislative offices and to be, with the purpose of it to be held accountable? Jason?
I would suggest that if we could, we say that's what we want to do, and that we word it in such a way that legislative offices is suggested as a committee, and that way when parliamentary council and other people get involved, they may point out that it may be easier to do it family and communities, or it may be easier to make a new standing committee, and that we don't handcuff them completely to the one committee. I think that's probably fair. I think it's legislative offices, but my experience, I know my counterparts who are MLAs' experience is often you get parliamentary council involved and they'll go say something, they'll go, oh, that makes sense, and they're not here.
How's that sit with everybody? So the suggestion is it goes to the legislative office. Of course, that's something that's being suggested by the committee, but might turn different as people investigate it further. But a standing committee. Deborah?
I was actually just looking at what the mandate was of the Legislative Offices Committee, and it's not, like it says that the committee doesn't have the mandate to approve changes to legislation. They can entertain officers' requests regarding proposed changes and forward the recommendation. They review salaries, and they approve budgets. So I think maybe we should just say a committee with an appropriate mandate, just to make sure that that's the intent we want to say, because the mandate may not cover what we're looking at.
Okay. Committee with appropriate mandate?
Read the rules, what can I say?
All right. Graham?
Yeah, I think, leaning on what Jason was saying as well too, the caution is that and now I'm speaking semantics around parliamentary procedure, but if families and communities had something else referred to them before then, that report could be tied up, especially if, let's say, you're doing a year review on something. So it may be important to note that that report needs to get reviewed at a prudent time too.
Agreed. And I think the key is that we're saying as per the Auditor General's recommendation, and there already has been pretty significant documents built that in regards to that recommendation that have been to committee. So by putting it in there, I think that gives enough instructions to the people that can figure out how to write it up.
Okay. All right. We good on that one? All right. So I want to go back, and I want to make sure that we've covered off everything we said that was important in Calgary. Cameron?
Yeah, there's, one thing I think is missing, and one I just want to maybe suggest a refinement a little bit. One thing that I think is missing from the Calgary document to the draft one recommendations is the concept of timeliness. I just don't see that anywhere in the various recommendations. I could be missing it.
Patty?
And there's actually, in the document we just got, that point was truncated significantly in what we're seeing. What we had up there was that in the event of a criminal investigation, the review must proceed up to the point of interference with the criminal investigation, and then we get a report every 6 months, so that if there's things that can be recommended and implemented in advance of the end of the criminal investigation, that happens, and then every 6 months, the advocate reports back and saying this is why we have not completed it, so it stays on the radar. And it wasn't reflected in this bullet.
Jason?
I think it's really important that we emphasize this because the reality is, I think it would be fair to say that often because the report gets stopped because of criminal investigation, there could have been 3 or 4 things that could have been implemented right away that may not have interfered with the criminal investigation and could have prevented similar situations from taking place immediately and could be put into action, which I think is what Patty's trying to point out.
Okay. Rick?
It seems an awkward question, but is there some kind of overpowering desire to truncate things? Or, because I thought, we go through things, we make it clear, and then through this desire to condense it, we lose sometimes the most important content. The timeliness, bang on. Like, that's like huge. And the fact that, we lose stuff like that. Like, are we done truncating? That's, guess what I'm asking.
Cameron?
Yeah, well, I think that's a fair question to ask, and I think that's what we're doing. Like, that's the exercise that we're undertaking right now is reviewing those recommendations and making sure that they capture those things. So,
Absolutely. So I'm going to change the question slightly, but get to the same end. So if you review the Calgary document and those 9 areas, did we miss any areas within the recommendations we came up with this morning, Cameron?
So I had mentioned that there was another thing that I wanted to refine potentially, and it's with item D, where it says, also note the need for similar understanding from the writer of the report. And I'm a bit cautious that could be a bit too prescriptive. Like having a report writer that's of the same culture as the child in care might be difficult to capture that specificity. So I just wonder, like, that would maybe be a goal to strive for. But if, the people that write these reports and write the recommendations, I imagine it requires very specific training. Like, you can't just say, hey, do you want to come write this report for us? It has to be someone who's involved in the process and knows the system well. So I just wonder if we can kind of bring that to maybe a cultural competence or something like that, but not being so prescriptive to say that the person writing the report has to have the same culture as the child.
Yeah. So if memory recalls, Patty, that was something that you added in. Would culturally competent work?
Okay, so I don't believe that I said that the person writing the report, I said that you have to have culturally competent, or maybe I meant to say culturally competent eyes on the interpretation pieces. And we need to be careful when we make statements like this. I know this was not your intent, but a statement like that would infer that there are no qualified Indigenous, Somalian, Filipino people to do the reporting. So I know that's not what you meant, but this is for public, and there are qualified people with cultural competence to write reports. What the idea here is that I was saying not just in the investigation, but in the creation of the reports, we need to make sure that culturally competent eyes are on the reports.
Thank you, and thank you for helping me clarify that. That was definitely not what I intended to say, and I'm sorry that it came out that way.
Okay. Thank you. Okay, so that's item D that we wanted to, that we felt was requiring refinement. Is there anything else from Calgary that we've missed in our recommendations? Bruce?
It's talked about, it's not talked about specifically, and that would be privacy.
Privacy?
So in today's version, under A, it's there, but it's not clearly stated in that way. So I don't have a solution for that, but I want to put it out to make sure that everybody has a chance to sign off on it.
So what I want to do right now is I want to look at Calgary, identify if we missed anything. I want to look at the terms of reference, identify if we missed anything, and I want to identify if we've missed anything that we've previously discussed and agreed to. Once we do that, we'll focus our time on developing those recommendations to make sure they get captured, or tweaking these recommendations to make sure they're captured. Jason?
Just to stick with your theme then, so I'll just say it, but we kind of tabled the internal side of this, so we should put that up and have a brief discussion about that, if that is our intent, and that may be, or if we want to go a different direction with that.
Okay. Anything else from Calgary that's been missed or hasn't been captured in these recommendations? Cameron?
I just, I remember when I said this in Calgary, I had Jason agreeing with me, so I knew it was a good statement about and the statement was striking the right balance between privacy, transparency, and accountability. And I think like the accountability piece is captured in these new recommendations, but having the privacy and transparency and accountability kind of all intertwined and having the correct balance, for me, is missing in these recommendations.
Okay. Anybody else, something missing from the Calgary sessions that hasn't been captured in our recommendations? Patty?
On the Calgary document, I wasn't in Calgary, but there's a little star at the bottom where staff director and phase 2 also indicated, but we were talking about, we need to talk about the internal review that increases public confidence. And I'm not saying the internal review doesn't at the moment, but we're talking about increasing the public confidence in the external review, and it's worth discussing how internal review is done and how transparency of action within the confines of the labor standard law, how can we still be transparent to families and communities that if there's a case of not criminal negligence, but just negligence in the job that is not criminal, that there is actions being taken without putting staff in a situation where it's very uncomfortable or transgressing these labor standard laws that are very important, but we still have to find transparency mechanisms within this employer-employee relationship. And I carefully say that.
Thank you. Same question. Anything from Calgary that needs to be captured that hasn't been captured yet? So right now it's privacy and really striking that balance between transparency and accountability, and then the internal review, something that is transparent to families and communities, increases public confidence, strikes that right balance between employer-employee relationship. Bruce?
One other thing would be on the Calgary document underneath transparency, it speaks to developing a bridge between issuing a recommendation and a mechanism for transferring information to service delivery. And we had talked about that knowledge translation process back to frontline. And it's talked about a little bit under the section A, but I think something more specific there.
So the knowledge translation from the front line?
From recommendation to frontline and management.
Okay. Okay. So I'd like you to do the same thing now with the terms of reference. In the terms of reference you have, if you don't have a copy, I can get you a copy, so just let me know in front of you. But you have 5 key pieces. In fact, I'll just hand this out.
Can I just add something to what Bruce said?
Yeah, just one sec. So Cameron, you have something to add snap. Something to add in terms of what Bruce had mentioned?
Yeah, just I agree with, we have a water situation here, so just bear with me. Maybe I'll just keep going. So just building on what Bruce said about the knowledge translation, and just for the benefit, I know there were some folks here today who weren't, we had a meeting on, I think it was Tuesday evening with folks from the front line, and their suggestion was very much in line with what Bruce said. And they sort of said, if the OCYA comes out with recommendations, that then the way the staff work, they actually have, I think, monthly meetings. So then those recommendations would be discussed kind of with the staff, and then anyway, all I'm trying to say is there's a mechanism for that to filter down to the front line, and that was supported by the staff we spoke to on Tuesday.
Okay, perfect. Thank you for that clarification. If I take us back now to the terms of reference, in the scope and purpose, your work is to include identifying recommendations that streamline, strengthen the child death review process, identify which agent has primary authority for conducting these reviews, examining internal communications protocols to ensure timely access to information for relevant agencies, developing criteria for which deaths would review, and making legislative changes. So if you look at those things and you look at the recommendations that we have developed thus far, is there anything that we have not done, Peter?
Sorry, I'm going back to this document.
Yep.
One of the things we talked about this morning was that the OCYA was going to be mandated to look at deficit and strength practice, and I don't see that in this document.
Okay.
Yeah.
So I'm just going to put a star on these notes just to make sure that gets captured. Okay, Rick.
Well, we surely haven't ignored it, but what's there is under the scope and purpose of making recommendations for legislative changes. I'm pretty sure this is going to require changes to the privacy legislation, probably to something, Children in Care Act or whatever the legislation is there, and probably we would need some legal advice because there potentially could be 10 or 12 or 15 other pieces of legislation that need some tweak or change or something, or not at all. So it's not a fault of the committee or you that we haven't met that yet. I just think that we need to apply some legal horsepower to it, probably closer to the end of the process than now, but it's worth noting that we haven't got there yet.
So I'll just make a note, legislative changes, likely something to be done after the formation of the recommendations.
Sorry, if I go off of what Rick's just talking about, one of the important pieces of that is that AHS, David help me here, but AHS is not per se government. And so the privacy notion was that we didn't want to protect from access agencies involved with the child, but we also didn't want the family story being told in a way that harmed the family. I think that was the balance we were trying to achieve. But it does remind me that the issue of the publication ban is not here. We were going to give we're going to talk about the window, changing the window for the family to have a bit more time to make a decision other than the present 4 days.
Would that fall under the privacy
That's
balance?
a privacy issue, yeah.
Okay. But it's good to acknowledge that that was
Yeah.
one particular area we discussed.
Yeah.
I'm going to ask more about those any particular areas that we've discussed and come to agreements on in a second. But I just want to make sure we capture that, what we've committed to in our terms of reference. So is there anything else within our terms of reference that is in there that we haven't put forward in a form of a recommendation just yet? Cameron?
Well, I just want to go back to the piece about the recommendations for legislative change that Rick brought up with respect to privacy. And I agree that that's something that we should look at,
Yep.
but I'm just thinking that more belongs in phase 2 than in phase 1.
Okay. Jason?
I'm not convinced we've tackled all the way the internal communication protocols between the agencies, which I think is partially some of the privacy things Peter was bringing up. I think there's actually some other issues with that. I'm also not 100% sure that we've completed the conversation on the criteria for which deaths would be reviewed. I think we touched a little bit in Child Youth Advocate, but it's like, when we say all of them, is that all children in care, all children receiving care, all children within 2 years, all preventable deaths within 2 years? Okay. Then we've done that one. So just on the internal one, that is the only thing I see on this list.
Okay.
And to my friend from Calgary Hayes' point, I'm not sure if this panel can tackle that privacy question by 8 or 9 o'clock tonight. So we may have to talk about somehow giving us a bridge into the next phase to be able to finish it.
Okay, Rick?
The other piece that I can't help but make note of, it talks about further, the committee will solicit feedback from subject matter experts. And we've certainly heard from subject matter experts, but several of them haven't had the handcuffs off to tell us what they really think, which means we haven't really consulted with them. They've given us general information, but they haven't been able to give us the expert information by telling us what they think. So which means they haven't really been consulted.
Okay. Let's move to the question around, is there anything that we've discussed previously? So in the same vein as Peter's comment around the publication ban, have there been other pieces of material that we've discussed and come to an agreement as a group that we haven't made a recommendation around just yet? So anything else that we've, basically roughly said as a group, what, we're going to address this that we have yet to address? Patty?
Have we done point 3, the internal communication protocols?
So-
But that is partly, Joni really spoke to that this morning about sharing information that is being collected between the internal and external review. That, so I think we did discuss it. Is it just a matter of getting a recommendation about sharing towards the, avoiding duplication of interviewing families over and over again? Because we've already said that we think that the external reviewer, the advocate, should have access to everything he or she needs access to, which is going to require legislative change that we don't have to worry about. But do we want to speak specifically to how information will be shared between the internal and external reviews?
So
Sorry, were you done?
Yeah.
I don't see, I think that's part of this scope, but I also think that some of the questions with that were internally, the breakdowns that we've seen between government departments, where we heard lots about trouble between AHS or other departments being able to get the information in between. I also, when I look at that, I also interpret it that it's about making sure the recommendations are being communicated across all the different departments that may be impacting children and care. I think we're close on that one. I think we could get it done, but I don't think we completed a recommendation on it.
Okay. Okay, so right now I have 3 pieces after we come back from break that we want to, or sorry, 4 pieces that we want to work on. One being the privacy, and we've made acknowledgement that it might not be something that we can fully solve in terms of recommendation tonight, but there's obviously a conversation that we need to have in terms of how we address this. One is the internal review, something that increases public confidence and is transparent to families and communities. We want to have something in place around knowledge translation from recommendation to frontline and management. And we are also wanting to include the publication ban, which is probably part of privacy, and the internal communication protocols. So when we come back from break, I'm going to split you into 4 groups. And we're going to go through a process very similar to what we went through this morning, in which you are going to draft a potential recommendation and then present it back to the whole group, and we'll try to refine that within the hour that we have after break. Does that sound good? Alrighty, so we have a break that'll take us till 5. If we can come back at 5 sharp, I would really appreciate it, because we're going to definitely need every minute that we have available to us this evening. So, thank you. Ask everyone to come back. It's 5 o'clock. If I can get everyone to come back to the table. So if we can all get back, I want to make sure we have the most time available in this next hour. So as I identified before the break, what we're going to do is we're going to take the items that we identified as, not necessarily being addressed in our recommendations, and we're going to get a chance to address them. So there's 4 core areas that we brought up. So I'm going to break us into 4 so that we have an opportunity to generate material on all 4 items. When you do this, what I want you to think about are the considerations that were in the Calgary document or in the terms of reference. I want you to think about what recommendations you've already created, and is there elements of that in any of those recommendations? And then I want you to decide, do I need to come up with a new recommendation, or do I need to strengthen one of them that I already have up on the wall? Depending on what choice you make there, I feel free to write down what you need to write down, whether it's a new recommendation or whether it's strengthening and enhancing one that's already been developed. The core is we want to make, or the key point is we want to make sure we don't leave anything behind. We don't want to forget anything that's important to us. So as I said, I'm going to break you into 4 groups. In order to do that, I'm going to make this very simple. I'm just going to number you off 1 to 4. If you're a 1, I'll ask you to sit here. If you're a 2, I'll ask you to sit here. If you're 3, I'll ask you to sit here. And if you're 4, I'll ask you to sit here. Once you find your groups, I'll assign you the area that you are going to be discussing and seeking a recommendation for. So I'll start with Graham. It's going to be simple for you. You're a 1, 2, 3, 4. 1. Rick, you're 2, 3, 4. 1, 2, 3, 4. So if you can please go to your spot, I will assign one of these missing or refined areas for you. Wandsworth Graham. Absolutely. Where's she at? Oh, here you go, Heather. I was told you required one of those. All right, who are my ones? Ones, I'll get you to discuss the balance, privacy with transparency, accountability, and the publication ban. So you're all of this. 2s, I'm going to ask you to look at the internal review. The ideas so far being discussed being increasing public confidence and transparency to families and communities. 3s, you're my 3s. I'm going to ask you to look at knowledge translation from recommendation to frontline and management. And 4s, I'm going to ask you to look at internal communication protocols. Yeah. Well, I wanted to put some of our crack staff on it.
You said that we can't do it, and there you got it.
All right, so I'm going to give you 30 minutes. 30 minutes to have the discussion and come up with something to present back. So again, that's 30 minutes for brilliance. Yeah. According to constraint theory, it often creates creativity. Stress and creativity. Publication ban I had under privacy. Yeah. No, just knowledge translation from recommendation to frontline. The legislative changes, I mean, the 2 comments I've heard. 1, we need to get legal advice beyond today. And then 2, there have been some pieces in here that would also require legislative changes in order to occur. All right, we saved 6 minutes. That's important. So for this next part, it's very similar to what we did this morning. What we are doing is we're going to present back to our colleagues We'll ask if there are any questions of clarification. We'll ask if there's any objections or enhancements, and then we'll look for levels of agreement. Alrighty. So is there a group who would like to go first? Nicole? So start by telling us what you were looking at. I think you're up here.
I know, but where is the thing?
Oh. Da-da-da-da-da.
Thank you.
No problem.
So we were in charge of knowledge transition from recommendation to frontline and management. So we had a conversation with Joni about what's already happening, because we don't want to duplicate or create more work or different work, and we wanted to see what kind of was working well. So kind of in our conversation, we thought that the OCYA provides us smart recommendations that are grouped into 3 categories: short-term, medium-term, long-term. This would help prioritize what has to go out into practice, because there's so many things that are happening with all the workers, and making sure that they're updated with the priority. We felt that having this come out through the OCYA might help assist with prioritizing the recommendations that need to be implemented. The second thing was, we know it's tough, but ensuring that the department responsible to oversee the recommendations is appropriately resourced, so that they have the staff that can actually do the information sharing to get the information out to the front line and to management, so that they're combining best practice, research recommendations into the changes that need to be implemented. Because you can't ask them to do a recommendation without having the people, resources available to actually implement it. And the third thing is to continue to use the policy to practice mechanism for influencing practice change and high-level directives to instigate immediate change. So these are things that are already happening, and we felt that they were good, and we don't want to take away from that. So if it's working, let's continue to do that. Am I missing anything?
Okay. So, oh, I saw a clap. Oh, I don't need this. Yeah. Jason, get that for me. So in terms of this, are there any questions of clarification from anything you just heard? Yes, Bruce?
So, and it's kind of in the number 3, in the first bullet point, policy to practice mechanism for influencing practice change. I guess the other thing that, to be even more specific, would be, how do we make sure that a policy, or that a recommendation that occurs in February gets to the frontline staff meetings in March 1st? That they have a conversation about that, that they talk about, oh my God, we need to pay attention to this, rather than it being in a report that gets sent to the office but gets lost somewhere. So it could be fact sheets, it could be brief info sheets, it could be agendas for team meetings, whatever.
Yep.
So Joni had talked about this already happening when it's that short timeline, when there's something that happens, that they do the directive. So for the short term, they have a process that the directive comes out, and I guess each office, Joni, would kind of implement it separately, typically from the manager down to the supervisors to the front line, so that those conversations are happening. So that would be in the more immediate, like it would be direct communication with it. Does that answer?
How do we know? How do we know that frontline
Joni?
staff are actually having a conversation and they get it, I guess? Because this is critical stuff, right?
So are you looking for maybe a reporting mechanism in there that goes back up?
No, but I could try. So we can measure whether or not people have read something that's been sent out. The secondary to that, which is probably more important, what I hear you saying, is how do we know, how do we do the ensure part after, which is a mechanism after. So we can let them know what it is that has to change, for what reasons, by when. Then we got to circle back to see if that has actually happened. So there's kind of 2 pieces to that. And when there's short-term, like imminent safety issues, we usually have not waited for a recommendation to do that because they usually become pretty obvious, but assuming that there's new things that come, that would happen immediately. And we've had some of those situations, but what we try to avoid is having multiple directives going out to the field, because then we've satisfied the obligation of the department to make sure it's been communicated, but we haven't sequenced, prioritized, knit these things together in any way that's coherent and digestible for everybody, and that they have the time and understanding. And so that is the inherent tension we've had around the